Good morning. You can just have a seat anywhere where there's books, and your t-shirts are up on the front table there. All right. Good morning. I'm live up here.
Oh, it's not live on Facebook at the moment.
Okay. Right here, the t-shirts. Just find your last name. You're welcome. Okay, good morning, guys. Good morning. This is class 1 of our 4-week CNA test prep course. We're going to teach you everything that you need to know, not just to pass the state exam, but also to be successful in the workplace. Okay. I am going to talk nonstop today for 4 hours. There will be a 15-minute break in there that we'll get to at some point. If you have questions, please feel free to raise your hand. Those of us that are attending virtually, if you're on YouTube, you can actually send questions to us through YouTube, right in the comments. And when you send the question, it'll show up on my screen, and I'll be able to read it and answer it live. So it's as if you were in the class. Okay, good. So for those of you who are here physically in class, if you don't come on Wednesday, you can still join live at 9 a.m. And we try to be pretty much on time when we go live, but give me a minute or two just in case of technical difficulties. But you can type in your questions that you have and attend from home as well. Okay. This is class 1. We will have 8 classes total. This class meets on Mondays and Wednesdays from 9 a.m. until 1 p.m. for 4 weeks. So not Mondays through Wednesdays, it's Mondays and Wednesdays. So I'm not here tomorrow, just so that you know. Okay, good. 2 days a week. Yep. 2 days a week, Mondays and Wednesdays. 9 o'clock to 1. Yep. Yep. Good morning. If you want to find your t-shirt on the front table here, and then you can have a seat anywhere where there's books. Okay, you can attend in person like you are. You guys all found the place. How many of you guys got the email yesterday that went out? Everybody get the email? If you did not get the email, make sure you let Jake know after class, and he will make sure that we don't have any typos in your email address. Make sure you're looking in your spam folder as well, because sometimes we do get routed to spam, especially if you have Yahoo and iCloud. For some reason, those two tend to route us. So you'll be able to access the replays of this class. Everybody has this page in front of you. I call this the blue paper. This is the first day blue paper. The very first QR code down here, this very first QR code. Everybody know how to use a QR code? Okay. This leads you to our page where all of our live streams are for your class. So when you get home later today and you're like, oh my gosh, I can't remember what she said, you can just scan this. It'll take you to the page. You'll need to scroll down a little bit, okay? Because at the top is where you registered for the class. That was the link you used to register. Then you'll see the 2 books, which you already have. So keep scrolling. You don't need those. And then you'll see the live stream that right now we're live on that page. But after class, it'll be a screenshot of the next one coming up. So keep scrolling down and then you'll see the replays. Okay, so all of the replays are on this one page for you to be able to access. And this is the QR code to access it. Good? Good. Now on your syllabus, and we're going to get to the syllabus in a little while. On the syllabus, again, that first QR code there is for that same page. So you have it in 2 places to be able to access. Good? Questions? You'll also get the link in your wrap-up email. We're going to make sure you have all the bases covered. Like I said, we make this easy. All right, you will get a review worksheet at the end of every class. Those worksheets are also on that same website, the QR code website. Those review sheets are there. So if you can't make it to class, let's say that you don't come on Wednesday for whatever reason, you have a flat tire, no babysitter, a meteor falls, I don't know. You don't show up for class. If you're watching a live stream, just click on the review sheet. You can print it out. Okay, so everything that you have access to in here, you have access to virtually as well. And everybody that's joining us live can access those as well. You're going to get those, my students that are in here. Now, the people that are attending virtually, they have access to all of this, but there's a few things that you guys get that they don't. Okay, first of all, you get to be live here in the classroom. You also get practice time. Now, practice time, I'm not going to give you any until week 3. Because in week 1 and 2, we've got to build a foundation. It doesn't really do me any good at the end of class today, say, okay, ready, set, practice. You don't have enough skills under your belt. You'll sit there and stare at me instead of practicing. I know, I've been doing this for 20 years now. Okay, that doesn't work. You need a certain level of skill and confidence in your skill level to actually practice. Good morning. If you want to find your t-shirt on this table up front, and then just have a seat anywhere where there's books. Okay, you're welcome. So the first 2 weeks, there's no practice in class because I'm still loading you with information. Starting in week 3, we'll have a little bit of practice time at the end of class. So class 5, you'll get about 30 minutes of practice time at the end. Class 6, you get about an hour. Class 7, about an hour and a half. Class 8, about 2 hours. Now, during practice time, we sign off of virtual. Those people don't get to watch you guys practice, okay? But in here, we have the mannequin, we have the bed, we have all of the supplies, we have everything that you would use in the testing process here for you to be able to practice with. That's something that the people attending virtually don't get, okay? One of the other things that they don't get that you do is the wrap-up emails after each class. So you guys are the only ones that get that, and that provides quick links to everything that we talk about in class, as well as the replays. Everybody good with that? Yes.
When we're doing practice, are you here watching us and you're telling us that we're doing it correctly?
Yes. So in class practice, I'm in here. Now, what I don't do is stare at you.
Right.
Because if I'm standing over you, you guys are just starting your practice journey, right? You're nervous already. Now, if I'm just staring you down, that's going to make you super nervous. So what I do is I go behind this little shelf. I can still see you. I can still hear you. And I will jump in when I need to. But it removes me from your practice a little bit, and it helps you guys not feel so on the spot. Does that make sense? Okay, but I am here and I do give feedback. Now, the week after graduation, okay, so we're here for 4 weeks. The week after graduation, on Mondays and Wednesdays, there is open practice time during class hours. So from 9 to 1, that Monday and Wednesday, you guys can come in and practice. Jake is here for that. I am not. Open practice, I won't be here. In class practice, I am here. That's the difference. Now, I'm going to give you the tools that you need to be successful in open practice. We will have a sign-up sheet starting next week that you can sign up for the practice times. It is by sign-up only, okay? If you sign up for a practice session and you decide not to come, please let Jake know, because there's no sense in him sitting here when nobody's in this room practicing when I have other things that he can be doing. Does that sound fair? So it is by sign up only. And if you're not going to make your session, please let us know.
I confused because Monday and Wednesday class I come in.
Right?
So Monday and Tuesday, Monday and Wednesday only class, and another day practice.
The week after.
The week after. Okay.
Right, right. So Monday and Wednesday,
Yeah.
for 4 weeks.
Yes.
In here practice, I'm in here.
Okay.
After graduation,
Yes.
the next week,
Okay.
Monday and Wednesday, practice.
Okay.
Not required. It's available.
Thank you.
Okay, you're welcome. You're welcome. Do you have another question? No? Okay. We're going to make the skills so intuitive for you that you won't need me during practice. Okay. I'm going to make it very intuitive. Go ahead.
I did have another question. When you take the state exam, are they staring at you like you said?
Yes, they are,
Okay.
but they do try to remove themselves as far away as they can, depending on the skill, because again, they understand that the closer they are to you, the more your anxiety is going to ramp up. But we're going to talk a little bit about the test after break today. Okay. Good. Any other questions before we get started? Like I said, I'm going to make this as intuitive as possible. By the time we get to the end of next week, everything on that back wall, all those colorful banners that you see on the back wall, you will be able to recite all of those to me by the end of next week. Now, I'm not going to make you memorize them. Memorization means absolutely nothing. All of you guys memorized the Gettysburg Address in 4th grade. Could you recite it for me now? No, memorization means nothing because it's short term. You memorize it for as long as you need it, and then it's gone. Memorization isn't going to help you. It might help you for the test, but it's not going to help you in a clinical setting. And that's when it really counts, right? So we don't want to memorize these things. We want to learn them. So everything on that back wall, we are going to learn in the first 2 weeks of class. And we're going to use those principles to build the skills. Okay, so think of those as building blocks. We're going to learn the building blocks, and then we're going to use those to build the skills out of. Good? Questions? Have I lost anybody yet? All right. So we have 2 books for this class. We call them the yellow book and the skills book. Good morning. Oh, no worries. If you want to find your t-shirt on the table, it should have your last name on it, and then just have a seat at one of the 2 places with books. You can choose one of the 2. You're welcome. Okay, so we have 2 books for this class. One of them is the yellow book. The other one is the spiral book or skills book. The yellow book you're going to take home. Oops, let me go back. The yellow book you're going to take home, that is only for homework reading. We do not work out of that book. So it is a textbook. It's not designed to be engaging. It's boring. It's a textbook. Okay. You are going to be reading 1 chapter between Monday and Wednesday and 2 chapters over the weekend for every week of class. Okay, so tonight you're going to go home and read chapter 1. Over the weekend, you'll read chapters 2 and 3. Good? Makes sense? You will return this book on the last day of class. So please don't write in it. Don't make notes in it. Don't highlight it. It's not your book. It's on loan to you. You take it home, you leave it there. You're going to bring it back the last day. If you want to buy this book, my suggestion is to go to Amazon because they're going to charge you less than I'm going to charge you. Now, if you want to give me more of your money, that's fine. But, you know, Amazon will be a little cheaper for you. But if you go to that website that we talked about, this QR code, the very first QR code on our blue start paper, okay, FLCNA training. Remember I said there's 2 books there? Well, the yellow book is there. If you click that link, I will make, I think, like 22 cents off of the Amazon purchase. Okay, so full disclosure. But if you click that link, it'll send you to our affiliate site where you can actually order it from Amazon. It'll be here like the next day. Okay. to be completely honest with you, once you read this book, you will never, ever, ever open it again. It will be a expensive paperweight sitting on a bookshelf collecting dust. So that's why you're never going to refer. Now, the other book you will. We'll talk about that one in a minute. You will refer to that one again. But the yellow book, you'll never open again after class. So we provide it for you, but you will give it back on the last day. Sound fair? All right. The other book, this one. This is the book we work out in class. Okay. If you look at the bottom of this book, you'll notice it is written by me. Patricia Laramee, RN. That is me. Everybody calls me Miss Patty. That's how I'm known across the stratosphere. We are the #1 CNA training channel on YouTube. We have over 170,000 subscribers and over, I think it's 70 million views now, or 60 million views. I don't know. I don't keep up with it anymore. We're big. My book is used in schools all over the country. You're getting it directly from the author. Okay. This book is your constant companion, and it probably will be useful to you once you start work as well, because you'll have questions. We're not going to answer every situation you're going to come across in class. I mean, 4 weeks, we just can't cover every potential eventuality. So this book will be used by you once you graduate as well. That one's yours to keep. You can color it. You can make notes. You can highlight it. It is workbook style, so every lesson has questions to make sure that you understand the content, but that book is yours. Feel free to burn it or eBay it after class. Not my problem, okay? Good. Everybody understand the books? Okay, so before we get into learning all the skills and all the things that you think you're here to learn, we have to take a step back and learn a little bit about what a CNA actually is. What is a CNA? Now, you guys all have a vague idea of what a CNA is, otherwise you wouldn't be in class. But there's some things about this that you may not be aware of. So we're going to start out by learning about the scope of practice of the CNA. Now, this is also going to cover our very first banner called Skill Rules. And as we learn these principles, remember everything on the back wall we're going to learn. As we learn these principles, you're going to see a page like this show up on the screen. It shows you the book we're working out of. It shows you the page number. And it shows you the page itself. So those that are tuning in from home, if you don't have a skills book, you can kind of see it on the screen, but it's probably a little bit blurry. So if you go to YouTube, right under our YouTube live stream, you're going to see a little shelf. We just got this hooked up, by the way, this week. And you'll be able to order the skills book right there. So go to YouTube, find my live stream. Right below the live stream is our book. So order the book so that you can have your very own copy. Okay. Now, yours is black and white. The inside pages are black and white. I know that. What you see here is color. We are going to have a color edition coming in the next couple of weeks. Right now, we've just kept it at black and white because printing costs are unbelievable. Okay. And I would have to charge a lot of money for a color textbook. So right now, black and white, it works. Okay. But you can see the color on the screen. Everybody good with that? All right, so let's look at this page because we're going to see this page for every one of these building blocks. So go to page 17 in your book. And you'll see the banner. It says skill rules. And then it's got some very specific things about skill rules, things that we're going to learn. Next to it, you're going to see all of the different skills that this banner is associated with. And as you can see, they're all indicated here, which means that skill rules apply to everything we do. So it's a great place to start. Okay, good. Good. Now at the bottom, you'll see a little video clapboard. That means I have a video on this. And then next to it, you're going to see this. Now this is our scope of practice graphic. We're going to talk about this in detail in just a few minutes. But every page that you see here that has to do with a principle, that's what's at the top, learn the principles. Every principle page is going to be set up the same way with the principal banner, the skills that it's related to, the name of the video that you can refer back to learn more about it, and the fact that it's a principal part of our scope of practice. Good. So this one page looks kind of simple, but it has a lot of information on it. Okay, good, good. All right, so these videos, right, when you see this little video clapboard, these videos, the place that you find them is on my main website. So that's 4YourCNA.com. That's my main website. And this is an animated lesson. So you would want to look for the animated lessons. And that's where you would find that. But an easier way, much easier way, is that these lessons coordinate with my online course. I have a complete built-out online course. It's going to cover what you get in here plus a little, okay? All of you have access to that online course. You were enrolled yesterday. So you'll get an email that says you've been enrolled in the online course. Your login information is the same login information when you enrolled in this class. Okay, good. So all of you have access to that. So you would want to go look at the first lesson in that online, or actually the second lesson. The first lesson is a live stream because my live streams are embedded in the first lesson. The second lesson is what we're about to go through. Now, I said it's a little bit more than what you get in here because those lessons come with built-in questions. They also come with interactive activities that is really hard for me to do with you in class, right? Because they're individual. So the lessons that we learn in class, if you go online and do the online component for the lessons we do in class, it'll increase your understanding, your comprehension of that topic. Good. Now, some students never touch the online class, and that's fine. How prepared do you want to be for the state exam? I'm not going to be checking over your shoulder. This is adult education. I will ask for your grades on your homework just to basically identify who's struggling, right? If you tell me I got 100, I'm going to believe you. I'm not checking. It's adult education. But if you tell me you've got a 70, that triggers me to say, okay, what are you struggling with? Which questions did you have a problem with? Let's go through them together so we can make sure that you have the right amount of knowledge to pass the state exam. Good. All of these resources are available to you as part of this class, but it's up to you to decide what you're going to utilize and how prepared you want to be. Make sense? Now, the people that are attending virtually, again, they don't get the online course. They can enroll in it. I do have enrollment options for them, but that's something that you guys get that they don't. Good? Any questions so far? So we're going to start out with a video. Now, you do not have to take notes in my class. You do not. I've taken all the notes for you. In fact, the notes for the video are on page 18. So all of the notes are there. Yeah, this room only has 2 temperatures, hot and cold. That's it. Nothing in the middle. So bring a jacket or something. I will bump the temperature up here in just a minute because it is a little cold in here. But the notes for the video are on page 18. You don't have to take notes, but you do need to stay reasonably awake for this. This is the one lesson that I really need you to get before we move on. Because without this foundation, everything else we learn is going to be confusing. Does that make sense? You with me? So if you sleep through other videos, you can get caught up later. Don't sleep through this one. Okay? All right, so this video is going to talk a little bit about something called the activities of daily living. You're going to hear that term. The notes for this, again, are in your book, but they'll be on page 89. They're not with the same, they're not with the notes on page 18. They're a little bit different. But the syllabus is going to give you all of that information over here. You don't have to remember what is on what page, okay? All of the information for the topics that we talk about in class and some additional learning activities are all on your syllabus that we'll be going over in a little bit. Okay. So again, we make this super easy, guys. No stress. Super easy. All right. So Jacob is going to put the video on for the care plan and the CNA.
The care plan and the CNA, why it's always about the care plan. A presentation brought to you by 4YourCNA.com. Thank you for joining 4YourCNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job. Because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation. Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The
care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
All right. Any questions? No? So as a CNA, we follow the care plan, the whole care plan, and nothing but the care plan. What does that mean? Well, as a CNA, your brain is going to try to solve problems. It just will. And it will often do that without your permission. You won't even realize that you have deviated from the care plan. For instance, if care plan says to use a gait belt while walking a patient, you go to get the patient up, and the patient says, I'd really rather have my walker today. What would you do?
Unfortunately, you need to continue the way they were until you get with the nurse.
Right. We're going to follow the care plan. Now, if you have a concern, then we need to report that to the nurse. All observations, all of them, no matter how minor they seem to you. Patient isn't eating as well as they normally do. Patient is sleeping in a lot longer than they normally do. Patient is getting cranky about wearing clothes, and that's new, right? All observations that you make, the nurse needs to know. You don't get to pick and choose. You don't get to decide, yeah, that's normal. That's okay. The nurse doesn't need to know that. No. If you know, the nurse has to know. It's that simple. So on the state exam, some of the questions that you're going to get on the written test, one of the answers is going to be report it to the nurse. 99% of the time, that is the right answer. The rest of them will all be actions. Those are actions you are not authorized to take. Good. Now, there's one exception to that rule. It's a very important exception to that rule, and that is emergencies. Emergencies require action before reporting. So if we have a patient, you walk into a room, patient's on the ground, and they don't appear to be breathing, we're not going to stop and go tell the nurse. We have a patient who needs our help here, right? So emergencies require action. If you're in the dining room feeding a patient and they start to choke, you're not going to stop and go get the nurse. You are going to do an abdominal thrust because emergencies require action. If there's a fire, you're not going to stop and go let the nurse know, hey, there's a fire. You're going to remove the resident from the area of the fire because fire and people should never be in the same place at the same time. Okay? Action. Emergencies require action before reporting. Good? Good? Okay. So it's the care plan, the whole care plan, and nothing but the care plan. We don't change it, even when your brain tries to get you to go down that path. While we're doing those tasks, we make observations. And we report all of those observations to the nurse. We don't cherry pick. We don't decide. Good? That's the first banner. You just learned it. Now we're going to apply that to everything that we learn from here on out. This is not the last time you're going to hear me say it, not by a long shot. Will this be the last time? By class 6, you're going to be rolling your eyes at this. I guarantee it. Okay? I've been doing this a long time. I've been teaching CNA classes for over 20 years. I know what you need to know, but more importantly, I know how to teach it to you. Trust the process, it works. Okay? All right. So your role, we have to think about this real quick. Your role is to read and follow the care plan, make observations, and report those observations to the nurse, right? Remember this from the video? Remember this nursing process, right? So these are the 3 things that we are trained to do. We are to perform tasks. This is what you guys focus on mostly. we're going to make observations and we're going to report those observations to the nurse. Notice that observation makes up 2/3 of your role. 2/3. As a CNA, when you thought about being a CNA, you were thinking about brushing teeth, helping people with toileting, feeding people. You were thinking about this part of CNA work, right? But that's only 1/3 of your job. This is the part that gets missed. So we're going to spend some time on it throughout the program. Good. A lot of this you're going to be learning from your yellow book. It's your homework. That's why homework is important. In class, we're going to focus a lot on this. Any questions on that so far? You guys understand where we're going? All right. So we perform the skill as directed on the care plan. We follow the care plan, the whole care plan, and we're going to make observations, and then we'll report those observations to the nurse. Now, you guys all agree with that. Let's see if you can apply it. So in your book, go to page 20. I'm going to give you 5 minutes on the clock, and I want you to answer as many questions on page 20 as you can in 5 minutes. Remember, you can write in this book. There's pens and pencils in the cups on the table. Feel free to grab one. But answer as many questions as you can over the next 5 minutes. Those of you who are joining us virtually, again, you can purchase the skills book. Jake will put the link up if you want to order the skills book direct. Thank you, Jake. Jake, please make a note that we need to change those. Yeah. That one will work. It redirects, but those of you that are joining us virtually, if you're getting any value out of this, could you give me a thumbs up or a heart or something to let others know that this is helping you? Because that goes a long way on YouTube, and it's a great way for you to support our channel as we give out this information for free. We really appreciate it. Thank you.
This is a question. That one is the answer.
Right.
I
This is the
choose only
question,
one.
and then these are the answer choices. So you're going to choose one of those.
Okay. All
And then
three.
this is a question,
Mm.
and those are answer choices. This is a question. Those are the choices for
Okay.
this question.
Complete 4.
Right. As many as you can in the next 4 minutes. Got about 2 minutes left. And if you're done, just go ahead and put your pens down so I know who's still working, and we'll give you a little bit of time. Okay, about 1 minute. Okay. I know. And my voice is a little bit hypnotic, and that doesn't help. Oh, no. I'm so sorry. Feel free to get up and walk around if you need to. I know it's a little bit warm in here now, so that'll make you sleepy as well. Like I said, this room only has 2 temperatures, hot and cold. That's it. There's no middle ground. So I'm so sorry. All right, let's go ahead and talk about, let's go back here. Let's go ahead and talk about some of these questions, okay? So we're going to start with question 1. It says, you received the displayed care plan. How far will you walk this patient? What do you guys think? Why? Easy answer. Yeah, because that's what's on the care plan. Absolutely. Was anybody tempted to check A until the patient gets tired? Anybody tempted to do that? Why? Okay, easy answer. It's not on the care plan. Yeah, absolutely. You starting to see that correlation there? Okay, I used to give this pre-test when you guys walked in on day 1. So I used to do that. When people walked into the room, this was on the table and people took this test and everybody failed it because they had not gotten this information yet, right? Everybody failed it because everybody's checking, well, you walk them until they get tired. I mean, that makes sense, doesn't it? It only makes sense if you don't understand the role of the care plan. But you guys did much better. I stopped doing that, by the way, because I got a lot of complaints that people were failing a test before class even started, and it really tanked their confidence. So I stopped doing that. Now we do it this way. But I liked doing that because it showed just in not even an hour how far you guys have already come. Okay, that's why I liked that, because it was tangible. You could see that you had learned. So let's go on to number 3. You received the displayed care plan. Which body part are you going to exercise? Now, let me preface this by saying that we all know exercise is good for you, right? You need exercise. It takes oxygen to your brain and makes sure you think better. It oxygenates your skin and your muscles. It makes your digestion work better. It even helps your breathing. Oxygen is really, really good, and everybody should get at least 15 minutes of oxygen. Exercise is really, really good. Everybody should get at least 15 minutes of exercise a day. We all know this. This is a good thing, especially somebody who is maybe not very active, right? Because they've got some sort of illness or something going on. So, number 3, you receive the displayed care plan. Which body part are you going to exercise here? Not D? Why wouldn't you choose D? Easy answer, not on the care plan. Very good. Very good. You guys all are doing great. Okay. Now, let's go down to number 7. This will be a quick one for you guys because you've got this concept. What vital signs are we going to obtain here? Not all of them? I mean, patients in a clinical setting, don't they need all of their vital signs all of the time? Say it loud.
Not on the care plan.
Not on the care plan. That is correct. Now, this care plan is a little bit more detailed. How long are we going to count for?
1 minute.
1 full minute. That's right. Why? Because that's what the care plan says. This is the most failed skill on the state exam. pulse is the most failed skill on the state exam. The reason it is the most failed skill on the state exam is because of YouTube. Because if you go onto YouTube and you type in, how do you take a pulse? It will tell you. There's a million YouTube videos out there on how to take a pulse. I know. I've been on YouTube. Okay. Million YouTube videos. And most of them will say, count for 15 seconds and multiply that by 4. Because that's the industry standard, right? We're not going to stand at a bedside for a whole minute and count. We don't have time for that. We count for 15 minutes and multiply that by 4 to get our full minute reading. It's a shortcut. Perfectly okay. No problem. In fact, that's probably how you should do it most of the time, except when the care plan tells you to count for 1 full minute. But those videos don't tell you that. Those videos just say 15 seconds, multiply that by 4. That's all you got to do. Or the newer videos will say to use one of these. This is a pulse ox. Looks like a little clothespin. You press the on button, you put it on the finger, and it will give you numbers. One of those numbers will be the pulse. See if mine shows up today. Maybe. I have to hold still. Hold on. I'm not good at that. All right. There we go. My pulse is 74, right? So that didn't take a full minute. I put a clothespin on a finger, hit a button, and I have a pulse number. And we write that down, right? The reason that pulse is failed so often on the state exam is because this is the actual care plan from the state exam. And it tells us to count the radial pulse measured at the wrist for 1 full minute and record our readings. That is the actual testing care plan. If you get pulse, this is exactly what it's going to say. Exactly. Word for word. If you don't follow this, you don't pass. So you now have the key to passing the state exam. You get a care plan, and what are you going to do with it? Follow it exactly. Good. That is the key to passing the state exam. Wouldn't it be helpful if you had all of the care plans from the state exam? Wouldn't that be nice?
Yeah.
How many guys would want that if they were available? Yeah. Well, here's 4 of them right here. These are the actual care plans from the state exam, but you're going to be tested on 20 skills, and there's only 4 here. So go to page 25 in your book. These are the actual care plan sets that are used on the state exam. When you go take the state exam, you are going to get one of these 11 clipboards. This is exact, word for word. In this class, when you're practicing, I even have them available for you right here. This is how the care plans look for the state exam. They're printed on yellow paper. Mine's a little bit fancier because I like graphics, right? I have a little clipboard behind it. I've got some little graphics down here, so I'm a little fancier. But the words are exactly what you'll get on the state exam. This is the same thing you have on page 25. Good. So when you're practicing, you can simply grab one of these and do these 3 skills in the order listed, and it's just like you're testing. Now on the back of mine, just mine, are the actual checklists that you're going to be graded on. So you can see what you're graded on for the state exam. And they're always up here for you to be able to look at. Okay. Good. Any questions? One of those. So you're going to demonstrate 3 clinical skills. So one clipboard is 3 skills. Now, each one of those clipboards, and we're going to learn this a little bit more in detail after break, okay? But each one of these clipboards has a very specific type of skill set. There's one ADL skill. Remember, ADLs are things you do for yourself every day. So bathing, dressing, grooming, that type of thing. One mobility skill. So if we're moving the patient at all, like range of motion, transfer, ambulate, turning them over in bed, that type of thing. And one documentation skill. So all of that is detailed at the bottom of page 24 for you. So each one of those clipboards on page 25 has each one of those skills on page 24. One ADL skill, one mobility skill, one documentation skill. And we're going to get into that a little bit more after break. Okay. Good. Questions? So you have on page 25 all of the care plan sets that you could possibly get on the state exam. So when you go take the test, what's your name? Yep. Bobby Joe. So Bobby Joe, when you go take the test, you're going to be taken into a room with somebody else. I'll explain that in a minute. And the computer has generated one of these 11 clipboards. And they're going to give it to you and say, these are your skills. They're going to read them to you. And you're going to do those exact 3 skills in the order they're listed on your sheet. That's it. And we know that in order to pass, we have to follow the care plan. You now have about 90% of all the knowledge you need to pass the state exam, because you could figure out pretty quickly how to feed somebody. You could figure out pretty quickly how to wash somebody's hand. You could figure out pretty quickly how to get somebody dressed, right? Now, we have to learn some very specific situations, and we have to learn some rules that we're going to follow. And that's going to take up the rest of the 4 weeks. But you already have a foundation that you're going to build on. These are not all foreign skills, because most of what we do as CNAs, most are ADLs. You know how to brush teeth. We just have to learn how to do it on somebody else. You know how to get dressed. We just have to learn how to do it on somebody else. Okay, good? Makes sense? Good? So this isn't a hard class, guys. Most of what we have to learn are the rules. That's what we have to learn. You will need to practice these skills a little bit, because when you have rules, you have to practice them to put them into practice. Okay, good? But it's not hard. So this is what we were just talking about. Each one of these clipboards is going to be made up of an ADL skill, a documentation skill, and a mobility skill. The order may vary a little bit, but we're going to do the skills in the order that's listed. So this is the care plan set I was just showing you, right? The yellow care plan set. There are 4 documentation skills, and you will get one of those 4. Guaranteed. Everybody is going to either have to do pulse, respirations, feeding, or emptying the drainage bag. Guaranteed. You will get one of those 4. Hands down. So if I were to pick 4 skills that I knew I had to practice, those would be it. Because you know you're going to get one of those 4. Now, the rest of these are kind of up in the air. You're going to get one of these mobility skills. Range of motion, ambulate, transfer, side lying position. Okay, we're going to get one of these. These are the easy ones. And then you got the ADLs. Now, most of these we already know, right? We know mouth care. We're going to learn denture care. We're going to learn how to help somebody with a bedpan, hand and nail care, foot care, partial bed bath, peri care, catheter care. Dressing, making an occupied bed. These are things that we probably need to spend a little bit more time on to learn, because you're going to get one of those. We have a foundation, but we got to learn some rules. Okay. Good? That's what's going to make up the class. But I'm going to make it so easy to learn that at the end of 4 weeks, you're going to be like, am I really ready for the test? It just seemed too easy. It seemed too easy. But we're going to be doing some review so you can see just how far you've come in 4 weeks. And it goes fast, guys. Oh my gosh, these 4 weeks are going to go so fast. You're going to be sitting here in 4 weeks on graduation day going, oh, we just started. It goes fast. So try not to get too behind because there's not a lot of time for catch up. Okay. So we're going to get one of these 11 sets. And again, we have them up here. You have them in your book on page 25 as well. I do sell these in class. For everybody else online, all the virtual people, they have to pay $45.99. You guys get a discount on this. If you really absolutely have to have a set for yourself, I'll give you a discount on it. See Jake. We do have a smaller version of this, though, and these are called care plan cards. Now, it has the same information, the same 3 skills, right? Just doesn't have the checkpoints on the back. But these we have, oh, Jake, I don't have any care plan cards. Oh, there it is. Sorry. Thank you. All right. So these actually come in our practice kits. I'll tell you about practice kits later, but these come in our practice kits, but they're just really like short versions of, so if you want to practice exactly the way it would be done on the test, you can get these. And again, there's a discount for you. I didn't used to tell everybody, you know, in class, the stuff that we had available to them, but then I got complaints that, hey, I didn't know you had those. So along the way, you're going to know, you know, hear about some things. You don't have to get any of them. This is not a sales pitch. I'm not that kind of a person. I'm just letting you know what we have available to help you on your practice journey. Okay, good. Let's talk a little bit about your scope of practice. This is on page 22. This is the most important concept that I have to get through to you, and that's why we spend a lot of time on it. CNAs do not have all of the knowledge that the rest of the treatment team has. You're not nurses. You're not doctors. You are there to help perform routine tasks on stable patients as assigned by the care plan. That's your role. You are not there to make decisions at all. Because there's things about that patient that you don't know. For instance, let's say that I'm taking care of this patient and her care plan says that she has to remain upright between 7 and 9 a.m. every morning. Okay? So she's got to be sitting up between 7 and 9 a.m. every morning. Now, this morning at 8:15, she hits call light and I go in and she says, oh, honey, my back really hurts. Can you just lay me back? Just lay me down. Now, I know the care plan says 7 to 9 a.m. every morning, but here's my patient complaining and she really wants to be laid down. Why can't I just lay her down? Right, because there's something here you don't know. She takes a medication every morning at 7 a.m. that is likely to eat her esophagus. Okay, it eats the tissue of the esophagus. If you lay her down, gravity is going to allow that medication to go up from her stomach into her esophagus. And what's it going to do? Eat it. Is that good for our patient? So our care plan tells us to have the patient sitting up between 7 and 9. So our care plan says that for a reason, but as a CNA, you're not going to know the reason. Your job is to follow the care plan. Now, there's going to be times when you can't follow the care plan, like your patient asks to lay down, and you know the minute you walk out that door, if you don't lay her down, she's going to lay herself down, right? So we have to have another option. So if we can't follow the care plan for whatever reason, insert reason here, we have to have something else we can do. What do you think that something might be? go to the nurse, report it. Absolutely. So CNAs have 2 doors. That's it. We follow the care plan, or if we can't follow the care plan, we report it to the nurse. That's it. How hard can this test be, guys? You either follow the care plan or you report it to the nurse. That's it. That is it. We don't solve problems. We don't try to explain to the patient, okay, listen, you're on this medication, it eats your esophagus, we have to keep you sitting. We don't do, not our scope of practice. Because the minute that patient hears they're on a medication that's going to eat their esophagus, they start to freak out. You don't have the knowledge to deal with that. Not your scope of practice. We follow the care plan or report it to the nurse. It's the nurse's job to go in there and explain to the patient why they have to sit up. And they're not going to use the words, eat your esophagus. Okay, good? Make sense? Everybody with me? So this test is not hard, guys. It's really not. It's not. As long as you understand your scope of practice. Now, the scope of practice goes a little bit further than that. I'm going to turn the air down just a little bit because just a little. Hey, you're okay. Yeah, it's a little too much. Okay. Bring a jacket, guys. Okay. So we understand this concept pretty well, right? We follow the care plan, the whole care plan, and nothing but the care plan. We understand this concept. So all the notes I'm going to tell you is on page 13, but let's look at the graphic a little bit bigger. We understand this is the foundation of what we do. We follow the care plan, the whole care plan, and nothing but the care plan. That's our skill rules. We've already learned that. Okay. So this is a graphic, page 13. This is a graphic that explains our scope of practice very quickly, very easily. Okay. Yep, right there. Okay. So you're going to see this on the bottom of every banner over there. You'll see this graphic. So we know that this is the foundation of everything that we do, but it's not our whole scope of practice. Yes, we do follow the care plan, but that's not the whole story. We also have to know what we're allowed to do. And that's where this wall is going to kind of keep us in, okay? What are we allowed to do? Now, I'm in a ton of Facebook groups for CNAs, and this question comes up daily. The nurse asked me to XYZ, am I allowed to do that? Why are you going onto social media to answer this? Do you know how unfactual social media is? This is not a question you should be crowdsourcing, okay? We want facts here, not opinions. What am I allowed to do? Now, the answer to this is pretty simple. It can be summed up in this statement. CNAs do normal. What is normal? Normal is a routine task on a stable patient that you have been trained to do that was ordered by the care plan. That's normal. If it is not a routine task, you cannot do it. If it is not a stable patient, you cannot do it. If you have not been trained to do the task, you cannot do it. And if it was not assigned to you to do, you cannot do it. Good? Now, I'm going to go up a level here. This is what you need to know. But I'm going to go up a level here and just explain bigger picture. When a nurse, and remember, RNs are the ones that have to write care plans, right? Remember we learned that? Okay, when a nurse develops a care plan and assigns tasks, there are some things that that nurse has to determine before they can put that task on a care plan. One of those things is they have to determine whether the task they're assigning is allowed by the state for a CNA to do. Now, every state's a little bit different on this. This is why there is no national CNA. Don't fall for that, guys. There is no national CNA certification. There are a lot of scam artists that'll tell you there is, and they'll take your $275 and disappear because there is no national CNA certification. That's because every state has different statutes as to what CNAs are allowed to do. Okay, so the first question a nurse has to ask is, can a CNA do this in my state? The next question they have to ask is, does my employer allow the CNA to do this? Because just because a state says, hey, CNAs can take out IVs, the state might say that. Perfectly okay. As long as you're trained, you can do it. But the employer may say, no, not here. We only want nurses taking out CNAs, taking out IVs here, not CNAs. Now, why is that? That's because of lawsuits, litigation. Because if something goes wrong with this patient, they're not going to sue the CNA. You make what, 20 bucks an hour? You don't have anything. I'm going to get your Honda whatever, right? You don't have anything. Now, they might sue the nurse. Nurse has a little bit more than you, but not much. Not much. They're not going to get much there. Who do you think that patient's actually going to sue? The facility. That's right. They're the ones with the money, right? That's who they're going to go after. So the facility is going to decide their risk exposure. Yeah, yeah. So this facility decides, okay, in our facility, CNAs can do these things. Nurses do these things. Okay. Not something the CNA really has to worry about because you're going to follow the care plan. Yeah, the nurse, yeah, which was written by the nurse. Absolutely. Absolutely. You're going to follow, you're going to do what you're told as long as you've been trained to do it and the patient is stable, right? You're going to do what you were told, and that covers you. That covers you. Good? Everybody good with that? Okay. But we have to understand what that term normal is. So if you go onto Facebook and you say, hey, my nurse wants me to take out an IV, am I allowed to do that? You're going to get 457 different results from yes, you can to absolutely not. Who do you believe? Well, it depends on, have you been trained? That's an important consideration. If you haven't been trained, the answer is no. If you haven't been trained to fly a plane, do you think I want you flying me? No, don't do it. YouTube, although I make a good part of my living off of YouTube, is not training. Okay, good. The second thing is that the patient has to be stable. So if I go online and I ask, hey, can CNAs take out IVs? If the patient isn't stable, I don't care how much training you've got, the answer is no. So there's a lot of considerations here that Facebook can't answer. Make sense? This is your determination of whether you can do that task. Have I been trained? Yes, I was. Was it assigned to me? Yes, it was. Is the patient stable? Yes, they are. Well, then I can do it. It's a routine task. I've been trained to do it. The patient's stable. Let me go do it. No problem. If the answer is no to any of those things, stop. Now, remember, we only have 2 doors to go through. 2 doors. We either follow the care plan or. So if I stop, if I say, okay, this patient isn't stable, I can't do this task, who do I have to tell? The nurse.
So what do you mean by a stable patient?
Okay, so in order for a CNA to do a task, I have to, as the nurse, expect that there will be no speed bumps. Nothing is going to go wrong here. If I ask you to go in and brush somebody's teeth, I have to have a reasonable assumption that that's going to go smoothly. Routine task, stable patient. Now, if I have a patient who has esophageal varices that just ruptured, and this patient is projectile vomiting blood across the room,
It's not stable.
there's a pretty good chance that if you go in to brush their teeth, something's going to go wrong. Okay? Something's going to go very wrong. And it's going to look like The Exorcist in that room, right? Now, chances are you're going to freak out about that. That's going to freak out my patient and the visitors and the families and everybody in the hallway. This is not a good scenario. Right? It's got to be a stable patient. I have to expect that if you do this task, nothing crazy and weird is going to happen. Good? Make sense? Okay, so I can ask you, hey, can you go walk her to the bathroom? You know, help her to the bathroom. Use a gait belt. You're going to do that. That's fine. You've been trained. You know how. It's routine. She looks pretty stable. Everything is good. But if she is on a pain medication, super woozy, right, that's no longer a stable patient, because what could potentially happen here? Yeah, she could fall. Absolutely. Fall, pass out, faint, whatever. That is not a easy, that's not a no speed bump scenario, right? So who would have to walk that patient to the bathroom? That's right. That's right. It now becomes my job, because I'm the one that's able to think through scenarios and come up with decisions. That's right. And I know everything about that patient there is to know. Good? Good?
Ma'am, like a patient like a stable, and then like CNA help. A patient like a very like no stable, like very sit, and the responsibility for RN.
Right.
Like,
Correct.
okay. No like CNA.
No, because if a CNA is doing a skill on an unstable patient and something goes wrong, they have to figure out what to do about that. And CNAs don't think. Okay? That's why I said you're going to have your biggest challenge. You can sit. It's fine. Your biggest challenge is going to be not to think like a nurse. Okay? You cannot think like a nurse. They're different roles. Now, let me tell you a little bit about my history real quick, since we're on this. I try really hard to keep to my timetable, guys. I really do, but I go off on tangents, so just bear with me, okay? This is a kind of a fluid class. All right, when I first started teaching, like my very first CNA class, I thought, this can't be too hard, right? I'm an RN. I know what CNAs do. I'll just teach a CNA class. There's no special education that I have to teach a CNA class. And, you know, I'm an RN. I can teach. No problem. Don't have to get anybody's permission. So I got a group of people together and I taught them what I thought CNAs needed to know. And you know what I did? I focused on medical terminology and medical abbreviations and body systems and conditions. And they knew all about Parkinson's and CHF and strokes and all kinds of stuff that has nothing to do with being a CNA. I tried to turn them into mini nurses. That is not what a CNA is. A CNA is not a mini nurse. A CNA is the nurse's hands and feet, not their brain. And we've got to be really, really careful to make that distinction, because you don't have the same knowledge that that nurse does. And it's not, I'm not trying to put CNAs down. That's not what I'm doing here. You serve a vital role. But we have to be very clear about what that role actually is. Does that make sense? The majority of medical errors that are made by CNAs are made because CNAs made a decision. Here's one that happens quite often, actually. A patient is diabetic and they end up with shakiness, they get pale, they get sweaty, they just don't look right, they're a little bit dizzy, they're weak, and the nurse gives them orange juice and they perk right back up, right? Great. Now, on this particular day, the nurse is taking care of another emergency or on break or at lunch or whatever, and the patient is pale and sweaty and whatever. What do you think the CNA is going to do? Give them orange juice, right? Because they've watched that nurse do it a million times. So they give the patient orange juice. This time, the patient goes into a diabetic coma, DKA, and dies. Well, what was the difference? The nurse gave them orange juice. They got better. I give them orange juice. They die. I mean, what happened here? I don't understand. Well, what the CNA didn't know is the patient was wearing a wearable blood glucose monitor that transmitted their blood sugar levels to the office. The nurse went and looked and saw they have low blood sugar, gave them orange juice. It brought their blood sugar up. The CNA didn't know that. They've got information they don't, that, you know, the nurse had information they don't have. They made a decision based on what they saw. Remember, you don't have the whole story. Does that make sense? That is a real life example that happens about once a month. CNAs kill just as many people as surgeons every year. We just don't talk about it. I think we should be talking about it. I think that you need to know how to keep your patients alive. Right? The biggest way you can keep your patients alive is don't think. Now, those of you who have a burning need to think, go to school, become nurses. We need good ones. That's how I ended up where I'm at. When I first started in healthcare, I started as a purchasing agent at 18 for a hospital. Oh, that was awesome. Had a $2 million budget as an 18-year-old girl. Oh, this is awesome, right? But I've also got one of those minds that doesn't ever stop. So I started, well, why do you need 14 different syringes? What's the difference? Why are there so many different scissors? Why does this doctor like this and that doctor like that? And what are the differences? And so medical purchasing, I mean, there's just so many products that we use, right? But why? Why do you got all these different things? So I asked a ton of questions. Well, our sister department was sterile processing, where they do the sterilized packs for surgeries. So there was an opening there. So my boss, being a great boss, at 18 years old, decided that I probably needed to work there part-time because he had an opening and he could tell me what to do. And I was 18 and didn't know any better. So I'd work full-time in purchasing and part-time in central sterile processing. And that was even worse because now I'm building packs with these different scissors and different syringes and different sponges. And why? Drove my boss nuts. So my immediate supervisor, his name was Jim. I'll never forget him. He was an LPN. He was older. He had been retired and was doing this for something to do. And he was my supervisor and I drove him insane. And he one day made all of these arrangements without telling me a thing. No one in my family had ever gone to school. No one had gone to college or any advanced education. We didn't know how to do that. We had no idea what a FAFSA was or a grant, or you went to high school and then you went to work. That's what you did. He put me in his car at lunch, took me to the local VOTEC center, sat me down with financial aid, and helped me get qualified for the LPN program. He is the reason that I am here today. Because I asked a lot of questions and he just wanted me out of his hair, I think, right? But then I advanced. Then I went on for RN and now I'm here and I love what I do. I absolutely love what I do. And I can have a bigger impact on patients by teaching you guys how to care for them. Yeah. So it's important that we understand our role to make sure that our patients stay safe from us.
I'm older, obviously, so for the younger people here, I'm currently, the reason I'm taking this is because a month ago, I got stuck with my uncle being brought to my house, so I'm taking care of him.
Okay.
He's 85,
Wow.
and so I'm pretty much doing all this stuff, and I'm doing this to improve what I'm doing at home. Okay?
Very good.
Now, I have nurses coming in once in a while, and I'm not a medical person, but they'll say things and just assume.
That you know what they're talking about.
Right.
Yep.
Now, I have no problem saying, I'm not an effing nurse, so don't assume that
Right.
I should know. I
Right.
mean, I'm doing the best I effing can, but I'm not a nurse.
Right.
So I don't know these medical terms and things. Everybody in my family was a nurse, into nursing. I'm not.
Right.
Wasn't my field. So don't be intimidated, because if these girls are going to be working, these are going to assume that they know these things.
Right.
And
Right.
you're going to tell them it's not their job. But these nurses and stuff are going to be very condescending and say things like, you should know these things.
Yes. Some.
No, you don't.
Yes. Some
No, you
can.
don't. And don't be intimidated and let them boss you around and make you feel small.
Right.
Don't let them do it. It's not. You want to go into nursing and learn those things, fine. But that's their job to do that stuff. But don't want to make you feel small for not knowing it.
Yeah, and that's important. Remember that, and I don't want to over generalize here, because there are some very, very good nurses out there that take the time to work with the CNAs and explain things. And then there are some nurses out there that are very jaded and condescending, and they expect everybody. Yeah, I'm so sorry that you're having. Yeah.
Every one of them.
I'm so sorry that you're having that experience. I really
Well,
am. But I do
it's
applaud you.
It's unintentional, but every one of them.
Yeah, but I do applaud you for taking the steps you need to be able to provide the appropriate level of care for your loved one. And I do applaud you for that. We've had several family caregivers that have come through the home or through the class to be able to provide the care in their home for a loved one. So congratulations on that. Do you have a question?
Yeah, I was going to ask, are we going to learn at least like the general medical terminology?
You will. The yellow book is going to teach you a lot of the medical terminology, and the medical abbreviations are in my book as well. We'll get into that a little later in the program. Yeah, and none of it is very overwhelming. Okay. And it's not on the state exam.
Okay, no problem. I just wanted to know like where we go into working.
Yeah.
You know what I mean? So, yeah.
Yep. So you will pick up medical terminology as part of your homework reading. So if you look, turn in your skills book. Yep. If you look on page 195, let's just go to 195. This should be a good one. 195. These are the chapter tests you're going to take every day or every class period. Oh, sorry, I'm sorry, 185. Sorry, 185. 185. Sorry about that. At the bottom, you'll see 10 multiple choice questions at the top, but at the bottom are matching. Those are the terms that you need to learn from each chapter. Okay, so along the way, you're going to have terms that are basically definitions for every single chapter test that you're going to do. And that's where you're really going to learn that terminology. You're welcome. All right. So does everybody understand that we're doing routine tasks that we've been trained to do on stable patients? If it's not a routine task, if you haven't been trained to do it, if it's not a stable patient, and if it wasn't assigned to you by the nurse or the care plan, what is your answer? No, not my job. No, not my job. Okay. Now, so that provides our foundation, right? We follow the care plan, the whole care plan, everything, or nothing but the care plan. And then we have one side wall that CNAs do normal. That's just kind of a short way of saying routine task, stable patient according to the care plan, right? But we have to have another wall to keep us safely in our scope of practice. So that other wall are the principles guide performance. Those are all the rules on that back wall that we have to learn. Remember I said we're going to learn that in the first 2 weeks? These are all the rules. Here they are listed out. We're going to get to these as we go. Don't worry too much about this, but understand that these form our scope of practice. Now, above everything, this is super important. Above everything, it's all about the patient. Now, this is where students run into trouble. Because we tend to focus on us, especially once you get into your work routine, right? First couple weeks, you're new on the job, you're paying attention to everything, you're hyper-focused, right? And then after a while, you get into this routine and you stop paying attention to the patient. They become another task. No. Absolutely. They are a human. It is always about the patient. Now, unfortunately, this is not the situation you're finding yourself in. And I would say that, you know, that's unfortunate that you've got, you know, this, if it's all through the same facility or same employer, I would say it's a culture problem. Okay. At that facility, that agency that you're going through is probably culture.
I think it's just unintentional.
Well, I would hate to say that only because I've been a nurse for a very long time. Yeah, well, yeah, I was a hospice case manager for 10 years.
I've been doing home health for many, many years. And I've worked with Pinnacle to hospice to a lot of different agencies, and I've never ran into that problem. Like, you know, so it may be there had been a bad day or something, but I've never run into somebody thinking they're up here and I'm down.
That's
They
good.
think they're up here, and I think because I'm older, it's assumed that I should know these things. And
Yeah.
stuff, and no, I don't know these things.
Right.
And I'm, you know.
Oh, yeah, please.
And no, I don't know these things.
Yeah, and they should be a little bit better about reading the room, for sure. Okay, did you have?
I've met people similar to who you're talking about, and I've met excellent nurses that will help you.
Yeah.
One of the nurses at one of the first nursing home I worked at was like best nursing home in 2 counties. And she was amazing. She taught me a whole bunch of stuff. I can't do it, but she taught me.
That's awesome. That's awesome. And I think it's like any other industry. Like I've had really bad servers at Chili's.
I was a server at Chili's.
Yeah. And I've had amazing servers at Chili's. Yeah. So, I mean, not to call out Chili's. Yeah, that's just the first one that came to my mind. But yes, that, you know, we've had bad cashiers or service people at Walmart, and we've had awesome people that stopped what they were doing and took us to what we were looking for. So I think that's kind of a little bit in every industry. You've got some that are really, really good, and you've got some that are really, really not. Unfortunately, you just seem to have found the barrel of the knots. Yes.
That's where I want to go. And I feel
Yes.
like that it's very, very, very difficult, like dealing with people with dementia and stuff like that.
It is, and we're going to talk a little bit more about that on Monday. Okay. Yeah, we're going to talk a little bit about dementia on next Monday. So stay tuned for that. I don't want to get too terribly off topic here. All right, so what we have to remember, it's always about the patient. The patients have rights. They have right to refuse care. If the patient says no, what does no mean? No. No means no, period. There is no but at the end of that sentence. No means no. We have to remember that patients are adults. Unless you're in pediatrics, that's a whole nother can of worms. You have to have special training for pediatrics. But patients are adults. Now, those of you who are looking to go into dementia care, memory care, there is not a but at the end of that sentence either. Patients are adults. Now, we are going to work within that a little bit different. We have different strategies we're going to use. We have different ways we're going to approach the patient, and we're going to maintain routines as much as humanly possible with our dementia patients. But there still is no but at the end of that sentence. No means no. And if you try to force an adult to do something that they don't want to do, they are going to fight you. You try to make me do something that I just said no to. Go ahead. Go ahead. Try to make me do something that I just said no to. You are going to find a completely different Miss Patty. Right? That's normal. That is human nature. Just because somebody is in a position of dependency where they have to depend on us for help does not mean that they have given up their rights to autonomy. And we have to remember that. Patients have rights. They are not children. We do not retaliate. We do not punish. We do not restrict. Those are things you do to children, not to adults. Good. So above all, we have to remember it's always about the patient. If your patient is getting squirrely on you, it's probably your approach. Take a step back and look. Be self-aware enough to figure out, am I doing something to set this patient off? Good? Good. All right. And then the last part of our scope of practice is what we've already talked about. We report all observations, and this is over everything else, right? So we're following care plans, and we're reporting observations. We're doing normal, and we're reporting observations. We're performing our skills according to the rules, and we are reporting observations. We're treating the patient like a person, and we are reporting observations.
So if a patient refuses care, that's when you just report.
You report it. Absolutely. Now, I will tell you, when you come to me and say, hey, Mr. McGillicuddy won't let me do foot care, I'm probably going to ask you, why? So if you've got that information ready and loaded, makes this interaction go way quicker, right? So when Mr. McGillicuddy says, no, you're not touching my feet, you're probably going to ask, can I ask why? Now, we're going to be nice about it. Our approach matters here. I'm not going to say, why not? Don't you know that I've got things to do and you're making my life difficult, right? We're not doing that. We're going to go, can I ask why not? Is this not a good time? Do we have some visitors coming, or are you in pain? Is there a reason that we don't want foot care done? I'm going to be nice about it, but I'm going to try to get some information from Mr. McGillicuddy to find out why he doesn't want his foot care done. And then I'm going to take that information to the nurse and say, I tried to do foot care on Mr. McGillicuddy. He said, no, he's got some family coming in. I'll try again in a little while. And the nurse is going to go, cool. We are now on the same team. There's a thing about nursing that often happens. CNAs tend to become adversarial against nurses, or nurses can become adversarial against CNAs. Now, if CNAs and nurses are butting heads, if they're against each other, the person that always loses in that scenario is the patient. Because it's not the nurse and the CNA against whatever's trying to kill the patient anymore. Right. We've got to make sure that we are on the right side of the team.
Not to go off either, but if you do get an opportunity in a hospital, you're a CNA in a hospital, when nurses come in, are they able to, oh my God.
Train you? So we're going to talk about that right now.
Are they able to request what CNAs they want?
Oh, sometimes. Yeah, sometimes that does happen. But right now with the staffing the way it is, most likely not. But in a lot of settings, we have kind of staffing schedules. Like you're on every Tuesday, Thursday, and Saturday. I'm on every Tuesday, Thursday, Saturday. We tend to form a team. Okay. So this question, am I allowed to do that? Is going to be answered on page 14, where I talk about delegation. Now, we've already kind of talked about this, that the answer to this is, have you been trained? Is this a stable patient and a routine task? Now, I need you to understand that training does not have to be in a classroom. This is training, yes, but it doesn't have to be done this way. Training can be at the bedside. I can take you, Bobby Joe, right? It takes me 4 weeks to learn your names. And then you fly away. So I will ask your names a couple of times throughout the program. But if I bring Bobby Joe in, I say, Bobby Joe, I need to teach you how to do something on this patient so that you can do it for me moving forward. You're going to say, yeah, sure, right? Because that's an additional task. And I can bring you to the bedside. I can show you how to do it, and I'm going to watch you do it, and that way, if you've got any questions, you can ask me, and we're all on the same page. And now you've got a new task, makes you more valuable. That doesn't mean that you can do that task at a new employer just because you know how to do it. You would have to be assigned, and they may want to train you their way, how it's done. Good? Make sense? All right. So delegation is the process of a nurse deciding to give one of my tasks to a CNA to do. And the reason that I need to do that, in a perfect world, we wouldn't need you. Really. Everything that you're going to do, the nurse can do. In a perfect world, that's all we would have are nurses taking care of patients, the people that think and problem solve. That way, if a situation comes up, I can deal with it right away. I know everything about this patient, including how they're eating, how they're sleeping, their skin, their bowel habits, all of it. In a perfect world, a nurse would be doing your job. We don't have that. We don't have enough nurses. And honestly, it's kind of a waste of my time to brush this patient's teeth. Right? I could be doing a task in the time it takes me to brush their teeth. I could be doing a task that has more value. Does that make sense? So if I'm not going to brush it, yeah, go ahead. If I'm not going to brush this person's teeth, somebody needs to. So what I need is somebody that I can say, hey, what's your name? Monica. Hey, Monica, can you go brush their teeth? And I've got to know with a reasonable level of I just lost that word. Oh man, don't get old, people. You lose words. You lose words. Nobody told me you lose words when you get older. But a reasonable level of assurance that you know how to brush teeth. Okay. So that's what I need, is somebody that I can point to and say, hey, can you take the patient to the bathroom? Can you put them on a bedpan? Can you brush their teeth? Can you feed this patient for me? That frees me up to do tasks that have more impact. That's the role of the CNA. You are there to do tasks I would normally do myself, but you're going to do them to free me up to do other tasks. So that means that I can teach you to do other tasks to free me up, as long as they're routine and on stable patients. Good? Do you guys understand delegation now? Okay. So let's talk a little bit about liability, because that's the next question that comes up. But hold up. If I'm going to be trained to do new tasks, what is my liability? And the answer is none. CNAs do not have liability. As long as, here's the key, you are under your umbrella. What is our umbrella? Well, that's that whole scope of practice thing. We're following the care plan. We're doing it on normal patients. We're using our rules. We remember it's all about the patient, and we report all of our observations. As long as we're doing those things, we have no liability. The nurse holds the liability. So that means your nurse is probably going to be pretty interested in what you're doing with her patients or his patients. They may ask you questions like, hey, when you did foot care, did you make sure you didn't put any lotion between those toes? Now, you might roll your eyes and say, I know what I'm doing here. they're not asking because they're questioning your skill level. They're asking because they need information about that patient. Good. So you're working with your nurses as part of a team. And that's why everything you know, they need to know. So a question I get asked a lot is, doesn't this mean I'm going to be bothering the nurses a lot? And this was in the video. And the answer is, it depends on where you're working. If you're working in a long-term care setting, your patients don't change very often. Like Henry is Henry. Henry's been here 20 years and he hasn't changed a day at all in that 20 years. He's just Henry. So chances are you will have zero to report on Henry and Henrietta because it's long-term care and nothing ever changes. Now, if you're working in acute care hospitals, things can change hourly. It can be that quick. So when you're working in acute care, you're going to be working very closely with your nurses. You're probably going to be best friends. You're going to be going down the hallway saying, okay, this is on this patient, this is on this patient, this is what you need to know about this one. Let me go check on that one. Close. Long-term care, a little bit less. Good. Now, those of you who go into a patient's home for home care or hospice or anything like that, you are the primary set of eyes for the entire healthcare team. So your observation skills better be on point. Because if you miss something or you fail to report something, it can have long-term consequences on the patient because it's not going to get addressed. So home care, any type of home care, requires diligent reporting. Good? Good. All right, so one more thing, and then we're going to take our break, and I am way late, so I'm going to kind of have to speed up here a little bit, okay? Otherwise, I'm going to keep you a little over. All right, so patient experience. You're going to read page 21 on your own at home, and I'll go over that in a little bit, but let me just spitball this for you real quick. Every patient is different. Do not assume that 2 diabetic patients are exactly alike. Every patient is different. We treat them all differently. Individual. How many of you guys have siblings? Excuse me, anybody have siblings? I'm an only child, I don't have any. But siblings, right? You both came from the same parents. Are you exactly like your siblings? All right, you got the same DNA mix, but you're still different. Don't assume that 2 completely unrelated individuals are going to be the same, right? If 2 people with the same DNA can be that different, 2 people with totally unrelated DNA are not going to be the same. Make sense? So we treat everybody individual. But while we're thinking about how we treat patients, I'm not talking about medical treatment. I'm talking about treatment. Right? Are we nice? Right? How we treat them. There's a couple things you need to know about your patients. Number 1, they're not where they want to be. When you are sick, where do you want to be? Home, your bed, your comfort space. And if you're anywhere outside of that, that's going to make you grumpy. You're also surrounded by strangers, people you don't know. Just because they're wearing pajamas doesn't mean that they automatically get your respect. You don't know them. They are still strangers, right? And they're also a little self-absorbed because every patient that's sick thinks they're dying. Just ask them, they'll tell you. Okay, so they're a little self-absorbed at the moment. You are not seeing these people on their best day at all. And for us to assume, to expect that your patients are going to be nice to you, that is an unrealistic expectation. The maddest I ever got at a CNA, ever, was when a CNA told me, well, she started it. Excuse me? Okay, well, I'm going to finish it. And I'm going to finish it by telling you you're no longer needed today or ever again. out. Not with my patients. Patients have the right to be grumpy. Sick patients have the right to act sick. And you are grumpy when you are sick. You are grumpy when you are sleep deprived. You are grumpy when you are preoccupied. And to expect a different response from another human is stupid. Set your expectations. Now, if you have a nice patient, that's a great day. That is an awesome day. I'm going home with a smile on my face, but that is not what I expect when I walk into a patient care setting. I expect that these people are going to be in turmoil. They should be. And it's my job to bring a little nice into their turmoil. Good? Expectations.
How would you handle a patient that is like very flip-flop? Like one day they're very like nice and kind, and then the next day they have like a switch, I guess, like a BPD patient. I would.
Okay, we would report everything to the nurse. Okay. Yeah, and I'm going to work with whatever I've got. Okay. So I have a theory about this, and again, I'm way off topic here, but I got a theory about this, and I call it the bucket of nice theory. Everybody is born with a bucket of nice. Throughout your life, you give some of your nice away. You hold the door open for people. You smile at strangers. You give away your nice. If nobody else is filling your bucket, hey, Julie, if nobody else is giving you any nice back, what's going to happen to your bucket? Yeah, it runs out, right? It runs out. So the only way to get more nice is for somebody to give you some of theirs. Correct? It's called the bucket of nice. So when you have a patient who is not very nice, their bucket is dry. You being mean to them is not going to fill up their bucket. That doesn't do anything for anybody. What they need from you is a little extra nice. Yeah, kindness. Absolutely. So the people that are the least nice are the ones that need it the most. Now, you can take that philosophy outside of healthcare too. Especially on 19. Yeah. It's probably the one place I don't employ that principle. But if you catch me at a Jiffy store, I'll hold the door open for you. That's just the way I am. I smile at strangers. I give my nice away liberally. I do it consciously. Probably not when I'm behind the wheel, though. I drive a sports car and I'm human too. All right. So we're going to go ahead and take our break. We are running a little bit late. We're going to take a 15-minute break. Once we get back from break, I'm going to kind of hit the speed run here to get through what we need to get through before our 1 o'clock end time. So go ahead and take your break. I put 15 minutes up on the screen. Thank you. All right. Everybody caffeinated up? Okay, so we're going to switch gears totally now and talk a little bit about what to expect on the state exam, because that's probably where your mind is, oh my gosh, okay, I've learned all of this. Now, how does it apply to the test? What am I going to have to do on the test? How does the test work? We're going to get this information out of the way pretty quickly. I'm going to just do an overview of it. We'll get into a little bit more specifics later as we go, but this is a good overview. We will do test registration processes at the end of week 2, which is class 4, last hour of class 4. I hand out the registration forms. We go over them in class together. You will send them in when you are ready. Everybody registers as an individual. I don't collect fees. I don't do anything like that. We just go over the paperwork and I tell you what to expect. I tell you timelines and next steps. Okay, good. It's not what we're going to talk about today. Today, we're just going to talk about what to expect on the test. Now, I have a whole lesson for you on page 12 that goes over this. I have a video for it. How does the exam work? But on testing day, when you go take your test, our closest testing center to us is in Tampa. There's actually 3, maybe 4 now in Tampa. I'll tell you which one is closest to us. If you go down the Parkway, it's right off of the Parkway north of the airport. So it's not too terribly bad to get to from here. If you're in Citrus County, there is one in Ocala if you'd prefer to go there. But there are none in our geographic location. You will have to travel. Testing centers tend to be concentrated in large metropolitan areas, not small rural communities. Testing centers are open 7 days a week. They test 7 days a week. That means that you might be testing on a Sunday. They do not test on major holidays. So Easter, they will be closed, but Good Friday, they will be open. Okay, good. All right, when you go to the testing center, you're only allowed to take 3 things in with you. Your test admission letter, if you printed it, you don't have to, but if you have it, you can take it in. Your keys and 2 forms of ID. 1 with a picture, so your driver's license, passport, military ID. 1 with a signature, so a debit or credit card, your social security card, something like that that has a signature. Both names have to match exactly. That is a requirement. If one of your IDs has your middle name and the other one has your maiden name, that's not going to work. They have to match. Okay, good. Or at least, if it's initial, the initial has to be the same as the first letter, that type of thing. When you go into the testing center, you're going to go into a waiting room. Off of the waiting room will be 2 rooms. One is a written test room that has computers for the written test. The other is a skills room that is a skills setup. If I were to put a wall there and there, this would be our skills room. It's very small, 1 bed, supply shelf, very condensed. But it is also very private. So all the people out there in the waiting room can't see what you're doing in here. Testing is private. The evaluators are going to check you in. And when they check you in, they're going to look at your IDs, but they're also going to look at you. They are RNs. RNs are born assessors. I know more about you guys by just eyeballing you than you think I know about you, because I'm an RN and that's what we do. We assess for a living. They're going to look at things like your body size, what type of shoes you wear, if you're limping, if you have any visible cuts, anything like that is going to impact them. I'm going to explain why in a minute, but they are assessing you when they check you in. Remember, you're not allowed to have any electronic devices with you. So your phone should stay in the car. If you take your phone or a tablet in with you, they're going to make you lock it up in a locker. No study material either. Okay. All right. So once they get you guys all checked in, they're going to divide you up into groups of 2. And this is not random. They don't just pick you 2, you 2, you 2, and you. They don't do that. They look at what skill set you have. Okay. So the computer actually picks your skill sets. The evaluators don't. So when you register, your skill set is set by the computer. So what's your name? Victoria? Give me a number 1 to 11. 8. All right, so the computer's picked skill set 8. What's your name? Serena. Now, Serena has to perform these 3 skills that were picked by the computer, okay? So you are going to have to feed a resident who's in a chair. You're going to perform passive range of motion to elbow and wrist, and you're going to assist a resident needing to use a bedpan. Those are your 3 skills. The evaluator is going to read the care plan to you, and then they're going to hand it to you. And that is yours throughout your entire test. You can go back and read that in the middle of a skill if you want to. It is yours to refer back to, because remember, we are graded on following the care plan. So you can refer back to it anytime you need to, but you need somebody to perform those 3 skills on. So the evaluator is going to kind of look around and figure out who would be the best person to be your patient for those 3 skills. Okay, so if we've got somebody who just had oral surgery, well, they can't be the person for feeding. Make sense? Good. If we've got somebody who's got a sprained arm, they can't be a patient for range of motion. So they're going to look around to see how to match you guys up. So just for the sake of simplicity, I'm going to match you up with her because she doesn't have anything wrong with her and she can be your patient for all of these. So you are going to perform your skills on her. And then when you're done, she is going to get a different care plan set, probably not the same one. Now, I can put 2 number 8s together. There's nothing wrong with that. I can put 2, because if you don't know the skills now, watching her do them isn't going to help you, right? It's a little too late for that. So I can put 2 numbers, but chances are I'm probably going to put you with somebody who doesn't have a number 8 skill set. Make sense? So when you're done with your skills, you would get your own skill set. It's going to be read to you, handed to you. You'll do your skills on her. So what happens first once they divide you up into groups of 2, they're going to, before you ever get to the testing room, they're just going to tell you, you guys are group 1, you guys are group 2, you're 3, you're 4. You don't go anywhere. You guys are about to test. You guys, you've got about a half hour, 45 minutes to kill. You don't have to stay in the waiting room. You can go out to your car and you can study there. You can get on your phone there. You don't have to stay in the waiting room. They're going to tell you be back in 45 minutes. You guys are group 3. You've got about an hour and a half to kill. So Target, clearance shopping, get your mind off of this. You'll be fine. Be back here in an hour and a half. You guys are group 4. Margaritas at Chili's, 2 for $1. We'll see you in a little while. You'll be back in about 2.5 hours. So you guys, you're going to be brought into the testing room. Now, when you get into the testing room, you don't know where anything is. You don't know where the washcloths are. You don't know where the wash basin is. You don't know how the wheelchairs work. You don't know anything. What are they using for a privacy curtain? You know, all of those things. You're new. So they have to show you around. It's like a little mini orientation, and they're going to show you. These are all of our supplies. These are where you find the things. Here's your 3-drawer cabinet. By the way, all 3-drawer cabinets are always set up exactly the same. Top is grooming. Middle is bathing. Bottom is toileting. Well, that makes sense, right? Kind of like the body. Grooming, bathing, toileting, right? Kind of like the body. All of them are always set up the same. Please don't put a bedpan in the top drawer with toothbrushes. Let's not do that. Okay, good. But they're going to show you that. They're going to show you how to work the bed. And they're going to show you what they use as a privacy curtain for the testing center. Now, every testing center is set up a little bit different, but most privacy curtains are going to be structured kind of like this. And this is what you're going to see. Let me get that out of the way. We have, now they won't have a big TV in the way. That's for you guys. But the privacy curtain is only going to extend a short distance like this. It's not going to wrap all the way around a bed like you would have in a real clinical setting. That's because you are being tested. We have to see what you're doing. And if everybody has to get in that little cubicle with this big old curtain around it, it's going to get a little crowded. We want those evaluators as far away from us as possible while we're testing. If the curtain only goes a short distance, that means the evaluators can be, you know, back there and still see. Make sense? So they're going to show you what passes as a privacy curtain for the testing process in that facility. Sometimes it's just a shower curtain hanging on a wall. All right. Okay. Once they've shown you around, then they're going to get the care plan. They're going to read it to you, and then they're going to hand it to the first person testing. The second person becomes the patient for that particular test. Good? All right. Now, they're going to test you using very well-defined criteria. These are called checklists. The evaluators are not allowed to deviate from them at all. Every word means something, and every word has to be adhered to. Good? Make sense? This is not subjective. Very important that you understand that. This is objective testing. And the evaluators can't throw you curveballs, because if you're testing in Miami, you're testing in Jacksonville, you're testing in Tallahassee, and you're testing in Tampa, you have to have the exact same test for it to be a standardized test. So if they have your patient sitting in a chair and your patient laying in bed and your patient pretending to fall, those are not the same tests. Good? That's what I'm going to teach you in here is the actual testing scenarios, what to expect, and they are not allowed to deviate from those at all. Everybody clear on that? All right. So these are the checklists that we're going to use. You're going to see these in detail as we go through the program. Don't panic about this, but they are on the back of here if you want to look and see what they look like. Okay. In fact, I'll pass this around so you guys can all take a look. But we're going to go through these checklists with a fine-tooth comb. You'll know them. They're also on my skills videos. So at the bottom of my skills videos, you're going to see the actual checkpoint that I'm getting checked off as I'm doing whatever's on the screen. So we're going to associate the checkpoints with the action as we learn. All right, so let's talk about grading. So first question I always get is, how many steps can you miss and still pass? And the answer is, well, it depends. How important was a step? So let's talk about this lady. We have to brush her teeth. Is she in a safe position for mouth care? Why? Oh, so we don't want to kill her? So if we kill our patient during the test, do you think we're going to pass? Yeah, that might be an important step, right? We got to get her sitting up. So head of the bed elevated, really important step. If we miss that one step, we are going to fail because we've killed our patient. Good. Now, when you are brushing your teeth, you probably do so over a sink. And you're not standing like this brushing your teeth. You're standing like this. Why? Yeah, because we don't want to get all gunked up, right? So we kind of lean over the sink. That way any foamy mess that might fall falls on the sink, not on us. Well, when your patient is sitting up in bed, they're not sitting like this. They're sitting like this. So we know that foamy mess is going to get all over them. What can we put on them to help protect their clothing? Yeah, a towel, something, anything. I don't care. Paper towel, napkin, tissue, towel. Knock yourself out. Nobody cares, right? We want something, but we have to address it. Now, nobody has ever died from not getting a towel over them with mouth care. Toothpaste on the clothes doesn't kill you. Aspiration can kill you. So which one of those steps is more important, guys? Putting the head of the bed up. So the answer to the question, how many steps can I miss, is, well, I don't know. What are you missing? Right? Yeah. So our goal should be none, because the test isn't about you. The test will never be about you, ever, ever. Yes, I know you're the one being tested, but the test is not about you. Who do you think the test is about? The patient. That's right. So if you aren't treating the patient correctly, you are going to fail, because they're grading. Every one of those checkpoints is focused on the patient, not on you. right? So that's the secret to passing the clinical skills test. It really is the secret. Pay attention to the patient, not to your steps. How do they look? Are they in the middle of the bed or do they look uncomfortable near the edge? That should clue you in. Something's wrong here. Okay, pay attention to the patient. So as we go through, I'm going to explain the steps that are what we call critical checkpoints, things that you absolutely have to do, like putting the head of the bed up so we don't kill our patient. I'm going to explain those, but my goal is that you don't miss anything. Because when I'm the patient out there and you're taking care of me, and guys, I'm getting older. This is a very real possibility in my future that I will need medical care. And my goal is to train enough of you guys that I'm going to get good medical care. Okay? So when you're taking care of me, do you think I want good enough? No. I want top of your game. And every other patient out there wants the same. Okay? Good enough in healthcare is not good enough. Do you want a surgeon that's good enough? No. Healthcare, good enough is not in our vocabulary. Okay? So as we're doing these steps, we're going to get check marks. We do a step right, we get a check mark. You don't do a step, no check mark. You do the step wrong, no check mark. So if we do it right, we get a check mark. Anything without a check mark is called a deficiency. That's what they're called, are deficiencies. So on this particular checklist, we've got 2 deficiencies here. And the evaluator is going to put those deficiencies into the computer. And the computer is the one that's going to determine whether you pass or fail based on the weight or the importance of those 2 deficiencies. Good? Okay. I've heard a lot of people say, well, that evaluator failed me. No, they didn't. That evaluator did not fail you. The evaluator put into the computer what you failed to do. The computer failed you, but technically you failed you by failing to do required steps. Okay, good. Now, after the clinical skills, you'll go take the written. This can be done in the other order. You can do the written test first and then the skills, but usually the evaluators are in charge of this. They determine what's going to be first, skills or written. Usually, the skills are first and written is second. Now, if we've got a couple of people that are there to retake the written, so you have to retest what you failed. If you pass the skills and fail the written, you have to come back and retake the written. But the skills stay for 2 years. That passing grade stays for 2 years. You don't have to retake the whole test, just the portion you missed, right? So if I've got 3 or 4 people there that day that have to retake the written, we're probably going to do the written first so we can get those people out. They don't need to be here all day. Good? Make sense? But in most cases, skills first and then written. Now, when you're done with the written test, you will get your test results for both skills and written as you're walking out the door. The evaluators cannot discuss your results with you. They will not. They hand you your results as you walk out the door. I have a whole book on the written test, CNA test coaching. This is on your the blue page. It's the 3rd little QR code there. You can download it for free. But I've spent the last 2 days working on a brand new resource for you. Everything that we use in this class, I make, and I make from scratch. So all of those principles, that's all mine. All those rules are mine. This is an interesting way of looking at the written test, and it's mine. But I'm actually creating a written test helper for you that you guys, I'm hoping to have it done by the end of class, and you guys will be my pilot group. Okay. I'll give it to you guys toward the end of class. But every question on the written test falls into one of 6 categories. That's it. So you need to know 6 things to pass the written test. One of them is CNA. Okay, we're going to use the initial CNA for it. And it's consult, never assume. So if the answer is tell the nurse, that's probably the right answer, unless it's an emergency. Consult, never assume. That's what CNA stands for. Okay. And then we have the rest of them are facts, FACTS. Follow the care plan, act in emergencies, questions on clinical thinking. And that's where most people go to when they think about the written test. They think about that clinical thinking thing, right? What do I need to know about diseases and conditions? What do I need to know about medical terminology, right? Those are kind of the higher level nursing thinking things. So there will be a few questions on there, like what is a normal pulse level, right? That's a clinical thinking question because we have to know what normal is to be able to report abnormal. T is talk and treat. How do we talk to patients? What do we say? How do we deflect? How do we redirect? Right? So talk and treat. How do we treat the patients? And then S is your skills and performance. That's what we're going to learn to do in here. So the questions on the state exam all fall into one of those 6 categories. And the really cool thing is once you understand that, the answer comes to you like that. The answer is easy. It's right there. It can't be anything but that answer once you determine what they're asking. So you guys will be my test group. Each question is going to have a letter behind it. F, follow the care plan. A, act in emergencies. C, oh, I got to put my thinking cap on. This is a clinical thinking question. T, how do I talk or treat this patient? If you know that they're asking you how to talk or how to treat the patient, be nice, right? So we're going to find the nicest answer there is. So it's a really easy way of cutting out all of those distractor answers. So I'm going to teach you how to take the written test using this practice test. But I'm still working on it. I'm using Adobe InDesign and formatting is not cooperating. So bear with me. It'll probably be toward the end of the program. But we do have this ebook that will help you out in the meantime. We've had, I think, something like 15,000 downloads of this ebook. And the reviews are phenomenal on it. And it's free. It's free for you. Almost everything I do, I give out for free, guys. All right. One other thing to prepare you for the written test. This is the fun thing I get to do. I love doing the game show. Did you? Awesome. So this is my fun time. The first and third Tuesday of every month, I am live on YouTube at 11 a.m. on the first and third Tuesday of every month. I go through 15 practice test-like questions. There's 4 answer choices. You guys put your answer choice in the chat in the program I use, awards points. You compete for real prizes. And it's a great way of seeing 15 questions. We discuss the results, why this is the right answer, why these aren't the right answers. And you guys could actually get some free prizes out of it just simply for playing. It's a really fun way of preparing for the state exam. And again, this is on your syllabus. The third one on the syllabus is the game show playlist. So you can see all the previous ones that I've done. And I think I've done like 65 of them now. Yeah, I've been doing that for a while. It's fun. This is what it looks like on the screen. You can see the question for answer choices. After you guys all vote on the answer, I reveal the right one and then give you feedback, and then you're competing for prizes. All right, so once you're done, I don't know why I sat down. Once you're done with your test, the written and the skills, and the evaluators give you your results, this is what they're going to look like. Where is it? Here it is. Okay. This is what it's going to look like. That's okay. This is what your written test result is going to look like. It's what's on the screen here. It'll tell you all of the different categories on the test, how many questions were in that category and how many you got right. Okay. I want you to have 100. But the next question is, well, how many can I miss and still pass? And the answer to that is a whole lot more complex than just a number. I can't say, well, you can miss 11 and be okay. It's not that kind of a test. You have to pass each category. Now, if you look here, it says providing specialized care for residents with changes. There's only 7 questions. So if you miss 4 questions and they're all in that category, that means that you can't really provide specialized care for residents with changes very well should you be a CNA. Probably not. Study and come back and try again. We need to improve. So 4 questions technically can fail you on the state exam if they're all in that same category. But it's even worse than that, because there's 1 or 2 questions on the state exam that are called critical concept questions. Now, the ebook goes into this in detail. So if you want more information on this, get the ebook, but I'm going to give this to you in a nutshell. What this means is there's a question and 4 answers, like every other question. There's 1 right answer and 3 wrong answers, like every other question. But one of those wrong answers puts the patient in mortal jeopardy. And if you choose that answer, you will automatically fail the test. It's always an emergency question. Always an emergency question. Because remember, we have to act in emergencies. If you pick something that puts your patient in jeopardy, you cannot be a CNA. Because this isn't a situation that we can go to the nurse and get more information, or we can rely on somebody else to help us. This is an emergency. We have to act now. And if you pick the wrong action that puts your patient in jeopardy, you can't be a CNA. There is no do-over there. Does that make sense? So 1 question on the state exam, if you pick the wrong answer, will fail you. And I'm okay with that. Because if I'm the patient and you do something that puts me in mortal jeopardy and I die, there is no do-over for that. Right? Test is not about you. Test is about the patient. Good? Make sense? You'll also get a report sheet on the skills. Now, it looks a lot like the written. And at the top, it'll say, congratulations, you passed, because you guys are all going to pass. My students do great. So at the top, we've got congratulations, you passed the written. This is what it looks like. I'll pass this around for you guys to look at too. Congratulations, you passed the written. Now down here, it's going to have the skills that you had, but there's not enough room there. They're bad at formatting too. So it's going to go over to the next page, right? So tell you what skills you had. And then we have the most important page of them all. This is the feedback page. This is a list of all of your deficiencies. Everything you did not get checked off on the state exam. Remember, this is a step you did not do or you did incorrectly. Keep that in mind. A lot of people look at this, go, well, I did that. Well, you did it incorrectly if it's on this list. It's not just that you missed it. It's that you may have done it, but you didn't do it right. Good? Make sense? All right. And this is what's going to determine your pass or fail score, are the deficiencies. Now, in Florida, we have 2 evaluators. So most of the time you'll see a deficiency listed twice. That means each evaluator has to grade you independently. That means that both of them marked you off on that particular step. Okay. If you only see it once, it did not count against you. Did not count against you. It has to show up twice to count against you. So there is a benefit of a doubt there. Okay. Maybe the evaluator just wasn't paying attention, zoned off. You know, it happens. Good. All right. So I'll pass that around for you. All right, so the next question is, what if I make a mistake? And the answer is you can correct them. Yay! So page 33 is going to tell you all about corrections. Corrections are our friend. If you're doing a step or it's, oh, that's okay. No, you're fine. Here, hold on. There you go. If you're doing a step, a skill, and you do a step wrong or you forget a step, you can make a correction. You can say, you're fine, you're fine. You can say, I forgot to close the privacy curtain at the beginning of the skill. Correction, I would have done range of motion on the other side. I was on the wrong side of the patient. So remember that care plan is very important. We have to follow it exactly. So at the end of every skill, I want you to go back and read that care plan one more time and make sure that your performance matched what the care plan told you to do. And if it didn't, you can make a correction. You can say, oops, I turned the patient on the wrong side. Now, some things that you correct, they actually need to see you do. Like I can't say, correction, I would have counted the pulse for 1 full minute. No, you need to actually count the pulse for 1 full minute. They're going to make you go back and redo it. Okay. Some things you can correct verbally, though. I would have closed the privacy curtain before I started and then opened it at the end. Those you can make verbal corrections. But the whole point is not that you're perfect. It's that you recognize your errors and work to correct them. I can tell you, those RN evaluators have been nurses for as long as God, okay? They know their stuff. They are really, really good at what they do. Really good. They don't necessarily want to be there, though. I want you to keep this in mind. Those evaluators aren't punching a time clock. Like they don't clock in at 7 and clock out at 3 like most nurses. They're not working shifts. They're only there as long as it takes to get everybody tested. So if they're done at 1, they get to leave. So it's yeah. So it's just, you know, they have to be there for testing, but the sooner they can get you out, the sooner they can be home in their pools drinking their margaritas. Okay. So you have to understand that they know what they're doing, but they'd really rather be in their pools. Wouldn't we all? Right? So if you're taking forever to do these skills and you're starting over 1,000,000 times and you're making 1,000,000 corrections, I want you to understand that you are keeping them from their margaritas. And they're going to get a little grumpy with you. And they're probably going to suggest that you're not ready for testing. Why don't you try again in 30 days? Go home and study. You want to be as competent as you can be. You want to go in, get the skills done, and get out so that they can get home. And if that happens, if everybody's on the same page, this goes very quickly and everybody stays in a good mood. Okay, so you can use corrections. You should use corrections. But if you're having to make 1,000,000 corrections, the evaluators are probably going to suggest that you're not quite ready to be a CNA. And they're right. Because the test is not the end. We don't study to get to the test. We study and take the test so we can begin our career. The test is not the end. The test is the very beginning. So if you can't get past the test, you're not going to be any good in a clinical setting. That's the goal, is to make you a good CNA. The test is just your starting point. Does that make sense? It's a different way of looking at the test. Everybody kind of looks at the test as the end of training. No, the test is the beginning of the career. If you can't get past the test, you have no business being in the career. Good? Okay. Got to set our expectations. So you can make corrections at any time. When you make a correction, you get a check mark, just like you've done it. That paper doesn't know any different. A check mark is a check mark. Doesn't matter whether you got it because you did it or you got it because you corrected it. Check mark's to check mark. Computer looks at it the same. So make your corrections when you need to. My goal is that you are so dialed into these skills that you don't have to make any corrections, but you do need to know they are available should you need them. You'll be nervous on testing day. That's normal. It's normal. It's okay. The more you practice, though, the less nervous you are. All right. So let's get into how we're going to get through this class. Boy, am I late. Okay, let's talk about this syllabus. This is our master blueprint. And there's a lot of stuff on here, isn't there? Every row is a class. So you can see this whole row has to do with today, class 1. This row has to do with what we're going to do on Wednesday, and so on. So each row is a class. Each column is a function of the class. So the first column are the skills that we're going to learn. So we're going to learn skill rules. Oh, we learned that already. We can check that off. Let's check off skill rules. We got that down. But we also have to learn the opening and the closing and hand washing and indirect care. And I've only got an hour and 10 minutes left. The second column are lectures I give in class. So if you look at that second column, you can see what to expect on the CNA exam. Well, we just covered that, so that gets a check mark. Delegation and liability, we've already covered that. Patient considerations, we're going to be nice. We can check that one off. Testing care plans, you guys have all had a chance to see those. And puzzle it out are the rules on the back wall that we are going to cover in class, so we can check that off. So right here, second column, these are all the things that we have already done today. So we've been here a long time. Long time. 3 hours already. Did it feel like 3 hours? No. So we have a lot to go, though. The third column there is your homework. So you're going to go home tonight. You're going to read chapter 1 in the yellow book, and you're going to take the test on page 181 in the white book. And it tells you that right here. So if you can't remember what your homework is, remember Mondays are always 1 chapter, Wednesdays are always 2. Just remember that. And then the last column there are some additional activities that we may get to in class, or you may have to do them at home if we run a little low on time. So we talked about the 5 key phrases. That's our little house that we live in as a CNA. We talked about that. We did our care plan activity. We've talked about corrections or our friends, and we talked about skills grading. So most of the things that we, in that last column, we've already covered in class. But take a look at that last column for every class, because I may not get to all of them in class. And that's the appropriate time, you know, wherever it is in the syllabus, for you to cover it through the lesson on your own. Everybody got it? Do you understand how to use this syllabus? It looks very complex, but it's really not all that bad. At the bottom, you have 3 QR codes. One is for the classroom live stream. One is for my YouTube channel. The other is for the game show playlist. But at the very bottom here, there's some words, like under the grid, but above your QR codes, there's some words. And it talks to you about the online course all of you guys have been registered in. That's located on courses.4YourCNA.com. If you go to courses.4YourCNA.com and log in, you are already enrolled in the class. Just hit access course and you can watch all of the lessons in there. Okay? Everybody understand how to use the syllabus? All right. Remember that this book, the yellow book, is only for homework reading. I use a lot of repetition in my class, guys, so I say the same thing a couple times. Yellow book is only homework reading. Don't bring it back and forth to class. Take it home and leave it there. We're not going to use it in class. I don't like this yellow book. I'll be very frank with you. I really don't. but it is the best one on the market for a condensed version of the information you need to know. There's a couple things I don't like about it. One of those, and let me show you what I mean. In the yellow book, in the very back, you have an index. Can you guys look up care plan in that index? What do we know about the care plan? We have to follow it, but it drives everything, right? I mean, the care plan is like ultra important. So if you go to the index and look up care plan, we expect there to be like a whole list of places that the care plan is talked about in this book, considering how important it is, right? Yeah, and it's, if you go to page 7, it's basically the bottom of one paragraph goes to the top of it. That's it. Go look up page 7 and 8 in your yellow book. Page 7 and 8.
Oh yeah, I see that. It's literally just 3 little paragraphs.
So considering how important that care plan is, for it to have 3 paragraphs in this entire book, that's a problem. But it does have some very important information that you do need to know in it, which is why you're going to read it. But that's why we don't really use it in the class. What I'm teaching you is much more functional. And if there's ever discrepancy between what I'm teaching you and the yellow book, always go by me. Okay? I am specific to our testing processes. That yellow book is generic. Eventually, I'll get around to writing a book that replaces it, but right now I'm fighting with formatting. So, all right. So everybody understand the yellow book? Okay. Page 181 in your white book is going to be the test for the homework that you're going to read in the yellow book tonight. So you're going to go home and read chapter 1 in the yellow book, and then you're going to take a test on page 181 of the white book that just lets you know that you got what you needed out of that reading. 181. Yep, 181. White book. Yeah, and that's in on your syllabus here. It has all of that in that homework column. All of that's right here in the homework column. I'm just kind of leading you through it. That's all. But it's right here in the homework column. Good? Good? Okay, anybody ever take a test and not know how you did on it? Does that really help? Not really. I mean, kind of. At least you know what the questions were, but if you don't know whether you got it right or not, you can't really learn from it. So when you take this test, you're going to grade it. You're going to use the grading scale on page 201. End of the book. End of the book. The reason I want you to do this is because if you read it and you took the test and you missed the question, you're already in learning mode. You'll go back and look it up to figure out why you missed the question. You're in learning mode, right? If we wait until we come back to class to grade this all together and you miss it, you'll just move on. You won't care. You know, well, 90 is good enough. I don't care. I want you to, I don't care about these grades. I do not care. If I am the body in the bed, I'm not going to look up at you and say, Serena, is that right? I'm not going to look up and say, Serena, what did you get on chapter 4? No patient ever is going to care about what you got on chapter 4. What I'm hoping is you learned enough about chapter 4 that you know which of my symptoms you need to report to the nurse right now. Knowledge, comprehension is what we're focused on here, not grades. The only way for you to get that knowledge and comprehension is to assess yourself and then let me know where you're struggling. Good. So you can take these tests as many times as you need to get to 100. When you get to 100, I know you've got it. Grades don't matter. Comprehension does. Everybody got it? I know I'm probably the only teacher in the history of ever that says grades don't matter. It is true. It is true. Yeah, grades don't matter. Yeah. Okay, so let's talk about the skills book or the spiral book, and that's the one that we use in this class. This book has theory and it has skills. Right now, I'm going to talk to you about the skills part of the book. The theory are just, you know, that's kind of what you've seen up until this point, kind of lessons, words, right? Skills are going to be presented a little bit differently. Skills are going to revolve around rules. Those rules are called principles. Okay, and that's what we have on the back wall. So at the top, when I'm introducing a skill, for instance, this is pulse. When I'm introducing a skill, you'll always see one of these pages. This page is going to have the skill-specific steps, things that aren't principles, aren't rules, but steps we need to know. But it's also going to have all the rules that we have to follow to perform the skill. If we just go in and take a pulse, we will fail the test because there's other things that we have to do along with taking the pulse to make it a full skill. One of those things is to knock. That's a graded checkpoint. Identify our patient by name. That's a graded checkpoint. Introduce ourselves by name and title. That's a graded checkpoint. Explaining to the patient what we're there to do and getting consent. Those are graded checkpoints. Closing the curtain for privacy is a graded checkpoint. Washing our hands before we touch the patient. That's a graded checkpoint. So if we just go in and grab the patient's arm and take their pulse, we are going to fail because you just missed a whole lot of checkpoints. Make sense? Good. So when we're learning to do the skills, we have to learn the rules that are going to govern that skill along with the skill-specific steps. And that's what this page is going to give us is an overview, quick reference, snapshot. Now, we have the principles that are involved in that particular skill. We have a video for that skill. And then down here, we have test-specific information. Test-specific information. So to recap, because I forgot to hit my buttons here, down the side, you see an overview of the principles or rules that we're going to use. You have all of them spelled out on page 27. We'll come back to this later. And you have these, well, let me just explain. These principles or these rules are steps that are repeated on many skills. Okay, steps that are repeated on many skills. That's what makes them a rule. So when I was teaching, when I first started teaching, and I did such a horrible job, I mean, I really did, it really kind of prompted me, okay, hold up. I don't know what I think I know about this test. I need to back up and try to figure out a little bit more about the test before I try to teach it. So that led me on a journey to learn the test. And I am now a subject matter expert, world or a nationally recognized subject matter expert on Prometric testing. I know this test better than the evaluators that are testing you. In fact, Prometric actually uses our videos to train their evaluators. So we know what we're doing here. Okay. But I didn't start out that way. I started out not knowing anything. So as I was demystifying the test, I realized, and I printed off all of these checklists, I realized that step number one was the same. Every skill. Step number one was same words, identical, didn't change even a period, identical. Well, if step number 1 is the same, if I teach my patients to do that step and tell them do it at the beginning of every single skill, you get that check mark. So I wrote that down. Okay, step number 1, every student has to do this for every skill. And then I went to step number 2, and you know what I found? Step number 2 was exactly the same across every single skill. Didn't even change a letter. So I wrote it down. Step number 2, tell the student to do this step and they get this check mark every skill. Now 3 was not the same. 4 was not the same. 5 was not the same. But there were some at the end that showed up on every single skill. So I wrote those down. Have the students do this at the end of every single skill. Right? So I'm on to something here. There's some correlations here. So that's what led me to develop our rules or our principles that we're going to employ. They're based specifically on the tested checkpoints. And they can't be skipped. Good. So when you guys are in here practicing, and I'm hiding in my little space over there, and you don't do your openings, you don't. Hi, Mr. Jones. My name is Patty. I'm your CNA today. I'm here to brush your teeth. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. If you don't do that, if you just come in and start grabbing supplies and setting up, I am going to tell you that is not the beginning of the skill. And if you tell me, yeah, I'll do the opening during the test, I'm just doing the skill part, I'm going to say, no, this is the skill. This is not extra. This is the skill. Because I have found, I used to let students do that. Skip the opening, skip the closing, just do the skill part. And when they got to testing, you know what happened? They skipped the opening and skipped the closing and just did the skill part because that's how they had been practicing. How you practice is how you're going to test because you're going to be nervous. Your brain is going to check out. You have to have muscle memory. So I won't let you get away with that in this class. Not because I'm mean. It's because I'm trying to protect you from developing bad habits. Good? Make sense? All right. So we have skill similarities across multiple skills, and that's how we developed our principles. Now, we have 11 principles that we have to learn, but there's 4 in particular. These are called the big 4. There are 4 in particular that are every skill. They apply to every skill across the board. Now, we already know one of them, skill rules, right? We follow the care plan. Yep. And it's not just the care plan, it's the whole care plan and nothing but the care plan. While we're doing those tasks on the care plan, what are we also going to make? Observations. And who do we tell? The nurse. Okay, so you guys already know skill rules, right? So we have to learn the rest of these. And these 4 are going to apply to every skill, doesn't matter what they are. Brushing teeth, walking a patient, range of motion, feeding, doesn't matter. All 4 of these are going to apply to all skills. They're called the big 4. Now, the rest of the skills, sometimes privacy blanket will apply. Sometimes we'll need a barrier. Sometimes we'll need some linen rules. Sometimes we're going to be washing. Those will be building blocks. We're going to kind of pick and choose the principles that we need for this particular skill. But these 4, all skills. Good? All right. So all of those, so we have the short form down the side, but they're all spelled out for us on this page. So if you can't remember what skill rules are, you can look right here and it'll tell you. So I give you the short form and the long form on this synopsis page. If we keep going, above that, we have the short form of the skill itself. This is assuming that you know a thing or two about the skill. You've seen it at least once. Right, this is kind of a refresher, but let me give you this in terms you can kind of understand. I'm really going to shorten this. How many guys have ever made a peanut butter and jelly sandwich? How many steps are involved in a PB&J? 3 or 4? Yeah. Anybody have any other ideas? 42. Okay, well, let's start with bread. In order to get the bread, it's in a wrapper. You've got to undo the twist tie on the bread wrapper and open it up to get 2 slices of bread. Then you got to do the spinny thing and put the twist tie back on. Now you're holding 2 pieces of bread. Where do they go? You don't have one of those yet. You have to open the cabinet, get the plate, put it on the counter, close the cabinet, put your bread on the plate. Now what do you need? Peanut butter. That's in a pantry or a cabinet. You got to open the door, get the peanut butter, close the door, put the peanut butter on the counter, unscrew the lid, and put it on the counter. Now you need a butter knife. So we're going to open the drawer, get our knife, close the drawer, put the knife on the plate. Now we need the jelly. Go to the fridge, open it up. And I won't even talk to you about trying to search for the jelly or calling mom and saying, where's the jelly, right? You're going to grab the jelly, close the refrigerator, put it on the counter, open the lid, and now you can get your knife, put it in the peanut butter, spread it, jelly, spread it. Right. And then we have to put the knife in the sink. We have to put the jar lids back on, store your peanut butter, store your jelly, and now you can put your sandwich together and eat it. 42 steps. But you guys told me it was 4 or 5. Which is it? It's 42, but because we're familiar with it, our brain shortened it down to 4 or 5. We don't have to think about the twist tie and the bread wrapper. That's just part of the whole thing, right? Fair? Fair? All right, so when you're learning something, you need step-by-step instructions. Once you've seen it or done it, then you can just refer to a short form to remind yourself of the important steps. That's what that is. That is your 4 or 5 step peanut butter and jelly. But when you're learning, you need the 42 step peanut butter and jelly. I'm going to give you that too, but not on this page. Good? Good? Yeah, absolutely. Absolutely. We have skill-specific steps that we get into for every skill. I'm going to explain each one of these for every skill that we do, things that we need to know about that particular skill. And of course, we have a video for it. Now, down at the bottom are our test-specific information. You want to set this up when you're practicing like the test. That way it's a dress rehearsal. So you need to know who's going to be your patient for the test. In most cases, it's going to be another testing person. Most cases, like here. But there's some cases that we're not doing these skills on a real person. We're going to do them on the mannequin, like dressing, partial bed bath, peri-care, catheter care. That's not a real person skill for the test. So we need to know which ones are real people skills and which ones are mannequin skills. And I'm going to give that to you down here. I'm also going to tell you how long somebody with your level of experience should be able to do this test within. Okay, so pulse, somebody with your level of experience, which is none, should be able to take a pulse within 5 minutes. Our care plan tells us to count for 1. You should be able to do that within 5 minutes. Okay, good, good. All right. So on page 25, at the top of each one of those clipboards, remember we've seen this page before, at the top of each one of these clipboards is a number like 31, 33, 35, 39. That tells you how long you should be able to do this set of 3 skills. Remember, it's a set of skills for the test. So if you get that very first clipboard, they're going to tell you you have 31 minutes to do these 3 skills. If you get this very last clipboard, they're going to tell you you've got 39 minutes to be able to do these 3 skills. You should be able to do all 3 skills within that time frame comfortably. That's way more time than you need to do them. Way more time than you need. They're very generous with this. Very generous. So don't rush. Take your time. Think it through. Make the corrections you need to make. I have a whole lesson on this on page 71. You can read it on your own if you want to. We're going to move on. Okay.
So for certain things, like I know you were saying about how obviously we wouldn't do certain type of care on a live person. So on the clipboard, whenever it says like certain care and stuff like that, how would we go about performing it? Or do we just fake it kind of?
Nope, we're really going to do the care on the mannequin.
Okay, so Like put a catheter in and stuff, or that?
We don't put catheters in, we clean them. So yes, the mannequin will have a catheter and you will clean it. Just like this. So this is set up as a testing center. So mannequin in the bed has a catheter ready to go. Okay. Now, when it's a live patient skill, so let's say it's mouth care. Mouth care we're going to do on a real person.
Yeah.
The evaluator takes the mannequin out of the bed and puts you in the bed. Okay. Good. The evaluator directs the play. They set the scenes. You don't do any of that. The evaluator sets everything up. The evaluator knows which ones have to be done on a mannequin, which ones have to be done on a real person. They give direction. You don't have to do any of that. They set the scene. They will then tell you, you can begin. Okay, good. But you need to know those things when you're practicing. So you're practicing like the test. You want a dress rehearsal. And that's what this bar is going to tell you. So on this bar, if you see a mannequin, you don't have to turn to page 102, but like on page 102, if you see a mannequin there, who are you going to be doing this on in the test? So during practice, you should probably practice it on a mannequin. Most of you guys probably don't have a mannequin at home. So those are skills I probably would practice in class. Now, that doesn't mean you can't practice it on a Barbie. It's just a little smaller. But the steps are, the steps are the same. You can practice it on another human if you've got one willing. Sure. Steps are the same. Doesn't matter whether it's big or small. Steps are the same. Okay. I have had some students that there are some inflatable, like 3 or 4 foot mannequin doll things on Amazon for like $10. And some students have gotten them for practice, and that there's nothing wrong with that. Go right ahead. But remember that you do have practice time in class with the actual mannequin that you'll be using on the test. All right, some skills will have the patient starting out in a chair. Some will have them in a bed. That bar will tell you where your patient should be for the test. And then it'll tell you whether documentation is required. Now, some skills that are documenting skills, if documentation is required, it'll tell you what your normal values are. For instance, pulse. Normal value is 60 to 100. And for the test, you can be off by 4 beats in either direction and still be considered accurate. So if you get 76 and the evaluator gets 78, you're still fine. It's still considered accurate. Okay, there's a variance there. Now, remember that there's 4 documentation skills, and you will get one of those 4. You will. The way that this is timed, like if you get 31 minutes to do this skill set, the way they compute that is they look at the amount of time for each one of those 3 skills. And so if we go back, see how this has a time on it, right? They look at the time for each one of those 3 skills and they add those together. And then they put in another 3 minutes for hand washing and another 5 minutes for thinking. They call it transition time, but it's really thinking time. And they add all of that up, and that's how they come up with your total amount of time for the test. Now, what if you go over? That's a question I get a lot. It's not an automatic fail, but you're not going to get a check mark for anything you didn't do. And that is what could fail you. So the evaluators give you a 5-minute warning. They say 5-minute warning. Now, if you know you've only got 5 minutes, you probably ought to go into sonic speed, right? Turn on those afterburners, get through as many check marks as you can in that time, because that's what they're going to grade you on. Good? All right. So now go to page 53, and I'm going to explain to you how we're going to learn the actual skills. So this is our 42-step peanut butter and jelly. Now, if I could be that detailed with peanut butter and jelly, just imagine what I can do with a partial bed bath. I do want you to be aware, though, that 42 steps is peanut butter and jelly, right? All of the skills that we're going to learn are less than 42 steps. So theoretically, everything that we are going to do in here is easier than a peanut butter and jelly sandwich. So when you start to get overwhelmed, I just want you to take a step back and remember, this is easier than a peanut butter and jelly sandwich. I'm overcomplicating it. Let me just learn the steps with a little repetition. It'll be just as easy as a PB&J. Okay, good. Don't want anyone to get overwhelmed. All right, so at the top of page 53, you see the care plan. You see a little nurse pointing to a care plan. That's our care plan. That is the testing care plan. This is exactly word for word what you're going to be asked to do on the state exam. This is law. I give you the care plans for the test. They are not a secret. They are not a secret. They are published. But we do need to know what to do with them. We are going to follow them to the letter. No deviation at all. Below that are your step-by-step instructions, and these are taken directly from those checklists. I sat down with the checklists and I wrote out instructions based on that checklist. Now, the reason that that's important is because those checklists are written for nurses. They're not written for you. Students reading those checklists aren't going to have a clue whether you violated an infection control policy. You aren't going to know. So I took that checklist that's written for an RN, put it through the RN brain, and pushed it out in student-friendly instructions. And that's what we get here. Step-by-step instructions designed to adhere to that checklist. If you take this, do every step on it, you will get 100% on the state exam. I know. Because we've compared it. And so has Prometric. It's exact. So when you're in here practicing, remember I said the week after is open practice and I'm not here? When you're in here practicing, if you have your skills book open to this page, this is me sitting in here telling you exactly what step to take next. You should be practicing in groups of 3. One person is the patient. One person is performing the skill, the CNA. The third person should have your book. I forget about that. The third person, if I put 2 fingers up, it gives me balloons. If the third person should have their skills book open and be going step by step down that list, making sure the CNA is doing it right. All 3 people in that scenario learn. So when the CNA is done doing the skill, you change roles. Somebody else becomes the patient, somebody else becomes the doer, somebody else becomes the monitor. If you do it that way and all 3 of you have a turn in each one of those roles, by the time you get through all 3 people, you will know the skill. Now, if I'm standing there telling you what to do, it doesn't have as good of an impact as if you're actively involved. And that's why during practice time, I'm not here. Because you need to relearn. You need to learn to rely on the tools that you have. Good? You also have the videos, step-by-step instructions on the videos with the checklist right on the screen. And Jake can always put the videos up for you if you want them. All right, down at the bottom are your supplies. Every skill, if there's supplies used for that skill, the picture is at the bottom of the page. Page 37 has all of the supplies listed for you. So if you don't know what a bath blanket is, page 37 will help you. Everything in healthcare, I don't know why, has 2 names. I don't know why. It's hilarious, but everything has 2 names. We'll go over that as we go. Every page has some review questions. I am really late. Okay, let's move on. Here we go. All right, so we talked a little bit about courses.4YourCNA.com. This is the online course, okay, the online course that you have access to. And the way that I teach online is very similar to the way that I teach live. I break everything down and make it super easy to understand. I simplify everything. And that's because I have found that you learn better if it's intuitive. If it's like, well, yeah, duh. I mean, of course it would be done that way. It makes sense. If I just throw things at you, I don't just do it that way. Just do it the way I show you. Just do it. If you don't have the why answered, you won't remember it. It won't have an impact to you. So the online course is presented in a way that makes it very intuitive to learn. And remember that you all have access to that. So what if I told you that if you did one thing, you would get half of the checklist checked off? It would be worth learning that one thing, right? Well, if you look at this checklist, one thing, one law, one principle gets us half of our check marks. This is called the opening. The opening makes up between 1/3 and 1/2 of all checklists. And it's this simple. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'd like to insert name of skill here. Is that okay? I'm going to close the curtain, wash my hands, get my supplies. I'll be right back. And then I close curtain, wash hands, and get supplies. You do that one thing, and you're getting half of your checklist checked off. That's amazing. So let's learn that, right? Let's learn that. If it gets me half of my checklist checked off. So page 30 is going to go over the opening. This is our overview page. Opening applies to every single skill that we do. And our notes are on page 31. But the steps of the opening are pretty simple. Okay, first we read the care plan because we have to know what to do. We can't just go in and decide what we're going to do. So first we read the care plan. Then we do the opening. I know it's cold in here. I'm getting goosebumps. Then we do the opening. Thank you. Every skill starts with the opening. Every skill. Doesn't matter what we're doing. Every skill starts with the opening. Every opening starts with a knock. Okay, we have to knock. And that is a graded checkpoint. Announce self or knock before entering room. It's an actual graded checkpoint. Now, why? Well, think about a hospital for a second, right? You're there alone. You're scared to death. You're sleep deprived. You're self-involved because what's going on with me? And you're surrounded by strangers. That space that you're in, that you're occupying, has to have some sort of a safety to it because you're relatively undressed, surrounded by strangers. You have to have some sense of security here. So knocking before healthcare people enter the room helps preserve the sanctity or the safety of your space. This is extremely psychological. But when people barge into a healthcare room, it's very intrusive, and the patients can respond to that. Knocking, although it seems like such a small step, actually counts pretty big because we have to preserve the sanctity of that space for your patient. Privacy is going to play into it too as well. Think about all the things you do behind closed doors. I mean, all the things you do. You want people walking in on that? Any of them? Knocking is important, guys. It is. All right, then we're going to greet the patient. This is all about being nice. Good morning, good afternoon. Hi, hello, how are you? Right? We want to be nice. Set the encounter off on the right foot. And this is, believe it or not, a graded checkpoint. Greet the resident. It's not just, we can't be Nurse Ratchet. We can't just barge in and expect them to do what we want them to do because we said do it. That's not how healthcare works. Or at least it's not how it's supposed to work. I've seen those CNAs. I've seen those nurses. I've worked with those people. That doesn't mean that that's how we should behave. We're going to identify our patient by name. For the test, we do not use ID bands. In fact, most places don't, the majority of healthcare happens without ID bands. You guys don't have ID bands when you go to the doctor's office or to a walk-in clinic or in home care or in hospice, right? There's no ID bands where you live. The only time you have ID bands is in the hospital and a rehab, short-term care. You can't rely on ID bands to identify your patient. So how do you identify a patient without ID bands? You ask them their name. Same thing you do at the doctor's office. Somebody walks in the room, you're Serena, right? Everybody say hi to Serena. We know she's Serena. So if I walk in the room and say, hi, Jessica, how are you today? What is Serena going to say? Hey, 'cause you don't want what I got planned for Jessica, I can tell you that. Yeah, absolutely. So you self-identify. For the test, you can ask their name, what's your name, or you can just say, hi, Mrs. Jones. Now for the test, we're just going to use Mr. and Mrs. Jones. One word covers everybody. Everybody, you are now all Mrs. Jones. Congratulations. For the test, one name is all we're going to use. But calling somebody by their name is perfectly okay, because if they're not that person, they will let you know. Now, in the case of dementia, we would have a different way of identifying our patient that would be outlined in the care plan. System's already there. Good? Good? Okay. All right. So we're just going to, hi, Mrs. Jones. And then that is a graded checkpoint. And then we're going to tell them who and what we are. Now, we do want to tell them not just our name, but also our title. I'm Patty, your seat. Because if I just walk in and say, hey, I'm Patty. So, are you the Patty that brings the cookies? I like that, Patty. Are you the Patty that brings the needle? Yeah, not so much, right? So, your role will help them understand what you're going to be doing with them. So, hi, I'm Patty, your CNA today. Good? That is a graded checkpoint. And then we want to tell them what we're there to do. Now, you can put this in your words. I'm here to do some exercises. I'm here to feed you a snack. I'm here to take you for a walk. I mean, you can put them in your words. Perfectly okay. If you're nervous on testing day, which you probably will be, and your brain has exited the building because it's your first skill and you're scared to death, and I know how this goes. Guys, there will be people throwing up in the parking lot because they're so nervous during testing day. I get it. This happens. It's real. You can pick up that care plan card and you can read it right off the card. I am here to provide passive range of motion to residents' right hip, knee, and ankle. Perfectly okay. But the patient needs to know what you're there to do. Your words, care plan words, doesn't matter. They have to know what you're there to do before you touch them. And then you're going to add, that's a graded checkpoint. And then you're going to ask the most important question in healthcare. Is this okay? You have to get consent. That is correct. You must get consent. Just because they're in your location doesn't give you carte blanche to do anything you want to them. Absolutely. How many of you guys have rights? So you're in my classroom right now. You're in my domain right now. So what if I came in and told you all to do something that you weren't willing to do? That's right. You absolutely have the right to refuse. If I tied every one of you to these chairs and said, no, you can't go to the bathroom, you're going to wet yourselves today. Yeah, but you probably aren't going to be back, right? And some of you would be like me, and we're going to fight about it.
Oh, I would, yeah.
We're going to fight because there's no way. Just because you're in a position of authority does not mean that you have authority over me, right? Your patients have the right to make decisions for themselves. Just because they're in your setting doesn't mean that they've given up their autonomy. They are human. This is a graded checkpoint. Then we're going to close the privacy curtain. That is a graded checkpoint. And then we're going to wash our hands. That curtain is not clean. Think about all the people that have touched that curtain. That curtain is not clean. It has every body fluid, and I do mean every body fluid on that curtain. It is only taken down and physically washed once a year in most cases, sprayed with disinfectant spray occasionally in between, but it is not clean. Do you want that patient to get touched with those hands? So in your mind, if you touch that curtain, you automatically need to go wash your hands. Good, good. Okay, that is a graded checkpoint, but it goes a step further on the test. There's another checkpoint on the test that has to do with when you wash your hands. So yes, washing your hands is on the test, but also when you wash your hands. We can't touch our supplies until our hands are clean. So you can't walk in the room, get all of your supplies, and then introduce yourself to your patient. First of all, it's a little presumptuous. Like if I've got all the supplies and I walk in, what's your name? Ari. If I walk in and say, hey, Ari, can I? But I've got all the supplies, it kind of takes your ability to say no away, doesn't it? It's a little presumptuous. So that's one of the reasons that we don't do it. But the other reason is infection control. We don't have clean hands yet. Don't touch those supplies that are going to be used on that patient until your hands are clean. So we have to, not sterile, just clean. CNAs don't do sterile. It's a whole different modality. But we have to make sure that we are washing our hands at the right time in this setup. Good. So we knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. We're going to learn about hand washing here in a minute. Cardinal rule here, guys, is do not touch patient until your hands are clean. That is our cardinal rule. You do not touch that patient until you've washed your hands. I don't care what in the world is happening, unless it's an emergency, we don't touch that patient until they have seen us wash their hands. Wash our hands. Yeah. All right. So let me explain to you a little bit about the online course, what makes it different than our classroom lectures, okay? And we're going to do this together. So inside the online course, I've got a whole video about what I just talked about. And then we have this review activity just below the video. Now, this review activity is cards, 8 cards that represent all 8 steps of this particular activity, right? So we're going to try this together. What we're going to do in the online course, if you were doing this on your screen, is you're going to touch the words at the bottom, the title, and you're going to drag those cards where they need to go in the right order. Now, here we're going to do it on the screen. I'm not physically going to drag. Okay, so we're going to grab the bottom of the card to drag it and put it in the correct order. So this is the opening, but what is the first step that we need to do? How do we know what to do with each patient? We're going to read the care plan. Care plan is always step 1, always. So we're going to drag that care plan card up to the first spot. What's the next thing that we want to do? So we want to knock. Very good. What's the next step? Okay. Let's identify the patient. I'm sorry, I can't read it. Yeah, identify our patient first, and then we're going to introduce ourselves by name and title. What's next? Okay, explain the task. We're going to close the curtain, and then what are we going to do? Wash our hands and gather the supplies. All right, so we're happy with this so far, right? We're happy with, and we can make any changes. Once we get them all in the right location, we're going to hit that check button there. And if we did it right, we're going to get a gold star. Let's take a look. We got our gold star. If we got it wrong and it has retry, it's going to scramble all of them. It doesn't keep the right ones in the right order. It scrambles all of them. You get to do it all over again. This is called forced repetition. And if you really want to learn the steps of the skill, do the sequencing activities. You'll learn the steps. That way, when you come in and you actually practice, you know the steps, and it makes practice go a lot quicker. You'll have one of these activities for every skill we learn in the online course. Good? Good. All right, so the opening is knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. Don't touch the patient until your hands are clean. Now, so that's the one thing we're going to do at the beginning of every skill to get half of our checklist checked off. Good? Now, what if I told you there's one thing that we could do at the end of every skill to get about a quarter of all steps checked off? Right? So the opening is going to check about half. The closing will check about a quarter. So let's learn those. So there's a lot of steps to the closing, but we don't get a lot of check marks, and students get really confused by that. And that's because the closing, a lot of the steps that we have to take are grouped together in one checkpoint, which means that if you miss one of them, you've missed the whole checkpoint. So we have to learn these pretty good. Okay, good. So the way that I have a whole lesson of this, page 34, the notes are on page 35. But the way that the easiest way to remember this is there's 8 C's to the closing. You want to make sure, and I'm going to go through this really, really quick. You'll probably want to do the online lesson for this because I'm running out of time. You want to make sure the patient's in a clean and safe environment. Always leave your patient looking better than you found them. I love that principle. Leave your patient looking better than you found them. My LPN instructor taught me that almost 40 years. Oh my gosh, almost 40 years ago. And we're still in contact. She still tunes in occasionally to my live lessons. And she has formed the foundation of a lot of what I teach you. Teachers matter. They really do. And I give her all the credit. But she taught me this way back then. Always leave your patient looking better than you found them. So look around. Is there trash that needs to be picked up? Can the sheets be straightened up? Does their pillow need to be fluffed? Does their hair need to be brushed? Look at your patient. They should look better when you leave than they did when you came in. Okay? So clean and safe. But safe is a part of this. Safe means the patient's, and this is a graded checkpoint, the bed needs to be in the low position. We're going to talk about that in detail in a future lesson, but just remember the bed needs to be in the low position, okay, not raised. And that's a graded checkpoint. We have to ask if they're comfortable, and the test needs to hear this word. Are you comfortable? Comfort, though, is more than just physical. Now, are you comfortable is a graded checkpoint, but emotional comfort counts here too. We're going to address preferences. Do you want the head of the bed up? Do you want a magazine? Do you want your remote control? Do you want your crossword puzzle? They got to have something to do. They're sitting there bored, right? They got to have something. So for the test, we're just going to make it simple. Offer everybody a magazine. It checks it off for the test. In a clinical setting, look around your environment to look for clues. You want your phone, your crossword puzzle, but what do you have here that I can offer you? Okay. Emotional comfort counts too. And it is graded checkpoint. We're going to make sure they're covered. Now, my rule here is no knobby knees. I should not see their knobby knees. They need to be covered with clothes or a sheet, but I should not see their knees. If I see their knees, something went wrong. We're going to talk about that a little bit more as we go, but no knobby knees. Make sure they're covered. I want you to think about the vulnerability of this patient. They're laying down. That's already a vulnerable position. They're not dressed for company. They're in a hospital gown. That's very vulnerable. They probably don't have a whole lot on under that gown, right? Not suitable for company. And now take their sheet away. How vulnerable do you think they feel? Yeah, pretty vulnerable and not a good place to be. So we have to address this, make sure they're covered. Clothing, sheet, something. It is a graded checkpoint. We're going to open that curtain. Now, if the patient asks, can you leave the curtain closed? And sometimes they will. That's fine, but who are we going to tell? The nurse, because that's an observation. Yep. Closed curtains lead to isolation. Isolation leads to depression. Depression leads to a worsening of medical conditions. There's a direct correlation there. So if they don't want that curtain opened, somebody needs to know about it. Maybe they have a headache. Could be, but that's something the nurse needs to know. Maybe they don't like their roommate. Could be, but that's something the nurse needs to know. Let me tell you something about roommates real quick, and I'm going to get off on a tangent again. We just had a situation about 3 months ago where one roommate in an ALF beat another one to death with the leg rest on her wheelchair. The staff knew that there was tension between those two roommates, but they did not report it. Somebody paid with their life. Everything has to be reported. You don't get to decide that it doesn't matter. If somebody had told the nurse and the nurse had told management, they could have separated those two and we wouldn't have had a grisly, gruesome death. That's horrible. Patients are in that setting to keep them safe. We failed them both. It's on us. All observations are reported. For the test, that's not going to be an issue. Open the curtain. It's a graded checkpoint. Going to give them their call light. Now, a lot of people go, well, wait a minute. Call light first or curtain first? I know that curtain is dirty. Call light is just as dirty because patients in bed scratch what itches and then use call light to tell you about it. Okay. So call lights are dirty, curtains are dirty. Everything here is dirty. This patient's got cooties everywhere. Doesn't matter what you touch first. What matters is after you've done all of those things, we go wash those cooties down the drain. Good. Wash your hands after patient contact. Now you've got clean hands, no cooties. Awesome. Great job. That's a tested checkpoint. But now you cannot return to the patient because if you come back to the patient and give them their call light, you've cootied back up. Good. So everything you touch in this environment has cooties on it. You go wash those cooties away. If you touch something, you've re-cootied up. What do you need to do? Wash your hands again. So our cardinal rule here, super important, is we end skill with clean hands. So that's the last action you take, period. So if I've washed my hands and then I have to document, right? My cardinal rule is end skill with clean hands. Last step I take for every single skill. If I've washed my hands and then I document, what do I need to do? Wash your hands again. And that is a graded checkpoint. You cannot touch this pen until your hands are clean. That pen goes in your pocket. You really want those patients' cooties hanging out in your pocket? They're going to go home with you at the end of the day. And if you keep doing that, you're going to have cootie soup in your pockets. It's going to go home with you at the end of the day. Don't touch anything that goes home with you until your hands are clean. Document and then wash your hands again. Good? Good? All right. So these are the 8 C's of the closing. And your closing is going to sound like this. Thank you so much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Your bed is in the low position. Environment is clean. Here's your call light. Open the curtain. None of that matters. The order of that doesn't matter. Do it however you want to do it. Comfort, curtain, call light, clean, however you want to do it. Get all of them done. Thank you very much, Ms. Jones. Is there anything I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Bed's in the low position. Your environment's clean. Here's your call light. Open the curtain. I don't care how you get them all done. Just get them all done. And then you clean your hands. After you clean your hands, you chart if you need to, and then you clean your hands again. Good. You're going to hear this about 200 more times by the time we're done with the class. Now, I do have an activity for this. You want to end the skill with a patient that feels safe and cared about. But if we combine the opening and the closing, look how many checkpoints we've already got, and we haven't even got to the skill yet. Every checklist is like this. You're going to get between roughly, most of them are over half of your skill steps done with your opening and closing. Some are a little less, but most of them are about half or a little more. All right. So now we have to wash our hands. And we have to wash our hands at the beginning of every skill and the end of every skill. So now we're going to learn about hand washing. Okay, I'm going to teach you how to do hand washing. All right, so page 44 has our overview. And page 45 has our instructions. And this is the last lecture I have to give you, warm, dark, moist. Pathogens, or the bad guys, need 3 things in an environment to thrive. Now, I'm talking about just in general pathogens. I do understand that there are what we call extremophiles, which thrive in other environments. But for the most part, our garden variety pathogens that we are dealing with thrive in a warm, dark, moist environment. Bathrooms are usually 2 or 3 degrees warmer than other environments because we don't like to be chilled when we get out of the shower. Bathrooms are usually dark. We've been trained, turn the light off when you leave the bathroom. Now, what we don't want is a lot of moisture in the area. We already know pathogens are there, okay? So we don't want a lot of unregulated moisture in the area. So we try to keep our bathroom environments as dry as possible. Mop up the spills, that type of thing. But this is actually going to impact how we wash our hands as well. So just remember that warm, dark, moist is no good in healthcare. Anybody ever been in a healthcare setting? What's the temperature like in there? Yeah, it's usually cold, and that's because we're trying to reduce the pathogen proliferation. Yeah. All right. So keep that in mind, warm, dark, moist. So now we're going to learn how to wash our hands. And these steps are based on the actual checklist that's being used to grade you. So we're going to turn the faucet on. That's always step 1, turn the faucet on. Now, you don't need anything to turn the faucet on because your hands are dirty and so is the faucet. Not a problem. In fact, that faucet is probably, the dirtiest thing in the bathroom because we touch it with dirty hands after we do whatever it is we're doing, okay? So we know the faucet, not clean, not even remotely clean, not even kind of clean. But that's okay because we're about to wash our hands. So we can turn the faucet on with dirty hands. Once you've got that faucet on, we're going to wet our hands. Now, this is actually an important step, more important than you think it is. A lot of people will go in, they'll get some soap, and then they'll turn the faucet on and start rubbing their hands together. Go ahead. That's fine. The problem with that is that soap doesn't distribute on dry surfaces very well. We need wet surfaces to spread the soap around. So you want to wet your hands before you put the soap on. And believe it or not, this is actually a graded checkpoint. Wet your hands first. Once you have wet hands, then get your soap. And you need to use enough soap that we get a good lather. You're graded on bubbles for the test. You are. So you need a good lather. If you're not getting good bubbles, get more soap. Get more soap. Don't ignore it. Your evaluators are watching. Okay, you need a good lather. We're going to talk about that in about, I'm going to go over, guys. Please bear with me. I'll probably be about 4 minutes over today. I'm sorry. But we're going to talk about that in about 3 minutes. Okay. All right. So once you have soap on your hands and you bring them together, there's a clock right above the sink. Every testing center has a clock right above the sink. The evaluators are using that clock to time you. You have to rub for at least 20 seconds. At least 20 seconds. So this is the tops of the wrists, the backs of the hands, in between the fingers, the palms of the hands, interlacing your finger, in between your thumb and index finger, the bottom of your hand by your pinky, all surfaces for at least 20 seconds. Those of you who learned how to sing Happy Birthday, Twinkle Twinkle, or any other ABC, or any other, do not sing. Use the clock. Because when you're nervous, your singing speed is going to speed up and it's no longer an accurate gauge of time. Use the clock. That's what you're being graded with. 20 seconds minimum. After that 20 seconds of friction, you can move on to your nails. You go down each one of your nails with the thumb to clean your cuticles. And then you're going to circle the nails on the palm of your hand to clean underneath. Okay, so 20 seconds of friction, then nails, then circle. Good? Then rinse. So we're going to cover all bases. And look at this. If you miss one, this is all on one checkpoint line, right? If you miss any one of those, you don't get the check mark. So if you didn't do your wrists, you don't get the check mark. If you didn't do under your nails, you don't get the check mark. You guys see that? Okay. All right. These are the areas that are most frequently missed. Anything in red. And don't sing. We just talked about that. Once you're done with rubbing, you're going to go down your nails, circle on the palm of your hand, and then you're going to rinse. Now, when you're rinsing, do not touch the inside of the sink and do not touch that faucet. You need to rinse under the water only. The water is the only thing that should touch your hand. And once you're done rinsing, you're going to tap. This keeps your hands in the sink. It keeps the water in the sink. When you shake, where does that water go? And we're trying to maintain a moisture-reduced environment. Good. Tapping keeps your water confined into the sink. Good. All right. And then you're going to dry. Leave that water running. You can't touch that faucet. Is that faucet clean or dirty? Your hands are? Can't touch that faucet. So you leave that water running. You get your paper towels. You dry your hands. You throw those paper towels away. Don't use those. Wet paper towels rip. Wet paper towels rip. If you use that wet paper towel that you just dried your hands off with to turn that faucet off and it rips, you contaminated your hands. You're going to take that over to the patient. So dry your hands, throw it away. Get a clean dry paper towel and then turn the faucet off with that. Good? Good? All right. I'm trying. All right, Jake, throw the, throw the hand washing video up really quickly, please. And remember, this is your checklist. Everything counts. Okay, go ahead.
As I approach the sink, I can touch the faucet with my unclean hands because the faucet is not clean. I'm going to turn the water on to a comfortable temperature and wet my hands thoroughly. You must rub with friction for at least 20 seconds. I'll get enough soap to produce a nice rich lather and bring my hands together to start timing. I'm going to rub the tops of my wrists on both sides, the back of my hands, interlacing my fingers, in between my thumb and index finger, making sure that I cover all areas with sufficient friction. The bottom of my hand by my pinky and the palm of my hand. After cleaning my hands, I'm going to go down my fingers with my thumb to clean the cuticles. I'm going to circle my nails on the palm of my hand and then rinse. Being careful not to touch the faucet or the inside of the sink.
After rinsing, I'll tap to keep the water confined in the sink, and then dry my hands thoroughly with paper towels, being careful not to touch the unwashed portion of my lower arms. I'll throw those away and get a clean dry paper towel to turn the faucet off, because wet paper towels may rip and contaminate your hands. Okay. So, in the online course, in the hand washing video or the hand washing lesson, you'll have that same sequencing activity that you can do to put all of those steps in order. This is what it looks like. We're not going to do this in class because we're out of time. All right. Remember that the care plan sets that are being passed around, the gold paper, that has all of those testing checkpoints on the back of it, so you can see exactly what you're being tested on. But one of the things that you're being tested, go ahead. That's fine. No, that's fine. Sorry.
I gotta run, sorry.
No, I'm just going to keep like 2 minutes more. You're fine. Go ahead. Jake, you did review sheets?
Yes, ma'am.
Okay, good. All right. So indirect care is something else that you're graded on. And this is built into those checklists that you see here. I've got indirect care actually integrated into that for you. Indirect care is kind of how we treat the patient as well. How do we treat them? Are we nice, basically? All right, homework. You're going to read chapter 1 in your yellow book. You're going to do the test on page 181 in your white book, and then you're going to grade it using the answer key on page 201. CPR is not included in this class. You do not need it for the class. You do not need it for the test. You will need it to work. So if you do not have CPR, start thinking about CPR. We'll go over that a little bit later. Just kind of keep in mind, you'll see this QR code every single class. And this is to attend Julie's CPR in this classroom at a discount. She gives discounts to our students. You're going to get a wrap-up email today. If you did not get the email that went out yesterday, please see Jake before you go, and he'll help you with that. You'll get a wrap-up with a link for this particular class to be able to review it, and next steps, as well as the link to join to access the online course. Did I go too fast for anybody? Oh, good. Thank you. Is everybody coming back Wednesday? All right. Okay, you guys all got your review sheets. If you do these at the end of every class, okay, so sometime between now and Wednesday, if you do these review sheets after we go over all of this top content, when you go take your test, this becomes your study packet, and the students have told me that this becomes a very quick study reference for them, and they're acing the exams with no problem. So it condenses everything that we talked about today down into one page for you. All right, good. Questions, comments, concerns? All right, let me sign off of online. Thank you so much for joining us virtually. We do appreciate you. Give me a thumbs up if this helped you at all. We will see you live again on Wednesday at 9 a.m. for class 2. Have a fantastic day. Happy caregiving. Bye. Yep. I don't have it on this one, Jake.
Oh.